Okay, sorry about my tardiness here. Please don't report me to the speaker. Okay, we will open up this very informative presentation from the insurance department that'll tell us all the secrets that go on behind closed doors.
Good. Thank you, Mr. Chairman and members of the committee. My name is Jason Azes. I'm the Director of Health Economics at the New Hampshire Insurance Department, and it's so nice to meet you this way. I would also like to thank you for the privilege to present some valuable information to you, some of which may help to inform the important policy decisions that lie in front of you. New Hampshire is considered a pioneer state in terms of data-driven healthcare information. We were among the first states to implement an all-payer claims database. In fact, Alex Feldwebel and Representative Hunt were central forces in the legislation authorizing the establishment of this database, which we now refer to as the New Hampshire CHIS. We've taken the liberty to prepare for you a document and a set of slides that will advance your understanding of the New Hampshire CHIS and some of its outputs. We've also prepared some copies for interested members of the audience. Please flip through the pages while we talk briefly about several important concepts related to the medical claims data. My goal is to not talk about each and every slide, but to give you a 10,000-foot overview of what the New Hampshire CHIS is all about and New Hampshire health cost.
And to leave plenty of opportunity for people to ask questions.
The first couple slides talks about the statutory authority and confidentiality issues in the All Payers Claims database. RSA 420G11 authorized the insurance department to collect this data from its commercial carriers. The New Hampshire Insurance Department, DHHS, and DOJ have a data use and sharing MOU, or Memorandum of Understanding, for use of the New Hampshire CHIS. The data is twice de-identified, and HIPAA rules of confidentiality apply. Researchers all around the country may request public use and limited use forms of the data through an application process, which is currently managed by DHHS. So what is the CHIS? It's a robust data set consisting of medical, dental, and prescription claims data. Every quarter, New Hampshire Insurance Department and DHHS, as well as the UNH Institute of Health Policy and Practice, receives quarterly updates. When you're trying to understand data, you always want to think about who, what, and when. Who does the data represent? What does it represent? And in what periods of time is it representative? This includes claims from commercial payers, Medicaid, and opt-in ERISA plans, which are self-insured in the state. Some important variables are listed below. The most important one I've highlighted is the allowed amount. When we hear about prices and costs and paid amounts, usually we're referring to allowed amounts. But in addition, there are some other quantitative parameters, including billed amount, paid amount, and cost-sharing contributions such as copay, deductible, and coinsurance. There's also procedure codes, diagnosis codes, and indicator variables for insurance market category, provider NPI, and member demographic information. We're working to make more robust our variable for DRGs, which is diagnostic related groups, which can give us a better sense of some of the more complex variables in the CHIS database. Medical claims data is inherently not straightforward, so having the DRG parameter well developed will give us a better sense of the holistic cost of an encounter with a healthcare provider. To put into perspective the size of the database, I mentioned the 3 claims files, medical, dental, and prescription. The medical claims contains 117 variables, prescription claims 130 variables, and dental claims 122 variables. Currently, data extracts are retrospective from 2012 to 2022. So who uses the New Hampshire CHIS and how do they use it? We'll start with the New Hampshire Insurance Department. Our most important use for the CHIS is to derive rates for New Hampshire health costs, which we'll talk about in a few moments. We also use this data to assess New Hampshire provider network adequacy. In fact, New Hampshire has a very innovative, empirically based network adequacy review process. We also use the CHIS to support legislative policy making. For example, to review the costs of state mandates and to support the work of legislative
Yeah,
commissions
sorry,
like
could
yours.
you explain, because we have a lot of new members, what network adequacy means generically and specifically why it's important to the department?
Since the advent of managed care, where health insurance coverage was offered through the development of a network where the consumer has a financial incentive to get their care from within that network, the issue has become important of the adequacy of that network to serve all of the potential needs of the insured population. So when managed care came about, within a few years, all the states began to develop standards for adequacy of network. And those are usually expressed in terms of time and distance. So for various provider types or service types, there are standards for how long it would take to access that provider and how close they are to you. So those standards are developed, authorized in legislation in New Hampshire and developed through a specific rule. Is that good enough? Thanks.
Thank you. We also use the CHIS data to conduct market conduct examinations, such as the mental health parity exams that are underway as we speak now. And additionally, every year we're required to produce an annual report on premium rates and cost drivers in healthcare, and we use the CHIS data as a primary source of information for that report. Additionally, the New Hampshire Department of Justice uses the CHIS data to perform market concentration analyses as part of antitrust examinations. They do this under the New Hampshire Charitable Trust. They also use it to identify pricing anomalies that may be suggestive of monopoly power. And lastly, the New Hampshire Department of Health and Human Services uses the CHIS data to release to public to inform researchers, regulators, and even citizens on healthcare costs. They use it to compare costs among New Hampshire Medicaid plans and also to inform legislative bodies like yours. So now I'd like to discuss one of the outputs, one of the primary outputs of the CHIS data, New Hampshire health cost. You've heard much about it in testimony in the last several weeks, so I'd like to kind of tell you a little bit about it, inform you on what it is, how we derive rates for it, and the hopes that will stimulate questions from you after this presentation. So New Hampshire Health Cost is a trusted, free website created by the New Hampshire Insurance Department that connects over 250,000 people per year to information on healthcare and insurance. It compares costs for more than 250 common medical, dental, and prescription services, including MRIs, CT scans, mammograms, X-rays, ultrasounds, and ER visits. It also compares quality for hospitals across the state and includes patient satisfaction ratings. It can be used to compare benefits using an interactive, customizable tool for small and large employers and their employees as well as their families. Currently, there are over 269 services listed on New Hampshire Health Costs. Queries for costs may be stratified by insurance carrier, including the uninsured, and plan type, individual or group. You can browse by procedure keyword or enter a specific procedure code. So New Hampshire Health Costs has been criticized much for the price variability that some users have seen. I'd like to inform you about some of the sources of variability that are inherent in medical claims data and translated into New Hampshire Health Cost. Price variation can exist as a product of how hospitals bundle their services. about half of the services listed on health costs are expressed as bundled services. Oftentimes, when you go to a provider, it's not just one service that's performed, it's a series of common services. We try to get precision in our price estimates by bundling them in these common market baskets or packages called bundles. Case complexity, or also called case mix intensity, is an expression of how sick you are, how sick the patient is. This can be a major factor that drives variability in price estimates. The number of visits per procedure. Not all procedures are produced in one visit. Some require multiple visits, and this can inject much bias into the price estimates, as well as the frequency of procedures and the historical lack of price transparency and other competitive forces can all collectively collude to result in price dispersion or price variability, which is what we see sometimes in health cost.
Let me just interject that at this point in time, a lot of other states also have all-payer claims databases. And they have similar findings with respect to the tremendous variability that can exist for the same procedure from one provider to the next. So that's a consistent motif.
So the next couple slides gives you examples of how services that are bundled or independent are expressed on health costs. This first example is an example of arthroscopic knee surgery. And you can see wide price variability here, ranging from $3,700 to $12,000. I like to point out a measure on health costs called typical patient complexity that serves as a good example to see why such price variability exists. Notice how the higher price estimates are associated with higher patient complexities. The next example is an example of a lab test called PTH, or parathyroid hormone. And you can see that price ranges vary from $33 to $564, which is a very wide relative difference, with the statewide average being $52.
So when you have the precision of the cost, does that mean how precise this number is when the up or down? Does that mean how confident you are that this is the right number, or what is that, or is that is relative to everybody in its group?
Thank you for the question. That's good. That variable, that output, is a product of a measure across all of the data points for that service.
Right.
And we use the coefficient of variation. It's somewhat similar to a standard deviation or a standard error in statistics. So we use the coefficient of variation. The smaller coefficient of variation results in higher precision of an estimate. And if something is wildly variable, like you saw on the knee arthroscopy example,
Right.
that would have a large coefficient of variation in a less precise estimate.
Right. Well, like I'm looking at this PTH, which can't be any simpler than just a test, right? And then I'm seeing Littleton's 313. Well, that's low, and then Weeks Medical Center 332, very low. So what is that telling me?
So measures of variation, like, for example, like the coefficient of
Low
variation.
versus very low, but one is higher than the other.
So those are rankings of the size of the coefficient of variation. So it's hard to express that to.
I flunked statistics. I'm
Yeah.
sorry.
Basically, how confident you are
But
in that number.
Okay. You gonna try one more time? Why? Explain to me. What does that tell me? That do I?
I think what that is how much variation there is at that facility for that charge.
Okay, that's what I was trying to get at.
That facility, there's very low variation, and so you're going to get 360 grams.
That's what I was hoping. It is about that establishment, not comparing it to anybody else. Okay, great. Thank you.
Hi, thanks for taking my question. I know that you have another page part where you can see the quality of the hospital. Is there anywhere that links the pricing to the quality of this particular department or this procedure? Because you could pay, $3,000 or $6,000 and the the $6,000 one potentially, maybe higher quality and they get better outcomes.
So good. Thank you for the question, and that's a
That's our
good
next
question.
slide.
Yeah, it is. If you notice the little boxes next to each provider or facility
Yep.
name, if you click on that, you can click on several, and there's a box on the left box. You can see compare selected, a lightly shaded box that says
Yeah.
compare selected. When you do that, those facilities pop up and all of their quality scores for different pre-selected parameters come up.
Okay,
Yeah.
great. Sorry, I'm married to a doctor, so,
Yeah.
okay, thank you.
And those are a product of patient satisfaction reports for pre-selected parameters. Yeah, okay.
But overall, you should keep in mind the information on the next slide.
Yes, higher cost care oftentimes does not confer with better quality care. So research finds that there is no relationship for this. For example, some services like lab tests, there's little difference in quality no matter where you go. However, as we saw in the last slide, there is still big differences in cost. So now I'd like to talk about some of our future goals for the New Hampshire CHIS. Currently, hospitals and carriers are now, under federal law, required to post their in-network and out-of-network and uninsured rates on their websites. New Hampshire CHIS can be used to reconcile that the actual claims data match the price that providers or carriers list for any given procedure. This serves as a great consumer protection mechanism and is indeed a price transparency mechanism that is known to promote competition, exert downward pressure on prices, and reveal disparities in discriminatory pricing practices, all of which are good for New Hampshire consumers. I'd like to drill down to two specific innovations in price transparency. The hospital price transparency law requires hospitals to post in-network, out-of-network, and uninsured rates in a machine-readable file and a consumer-friendly format. Whereas the transparency and coverage legislation, which applies to carriers, requires them to post negotiated rates and cost-sharing information in a consumer-friendly format, as well as post in-network provider negotiated rates, historical out-of-network allowed amounts, and drug pricing information through 3 machine-readable files posted on their internet website. Ultimately, the goal is to get these entities to post up to 500 shoppable services, and a list can be found listed below. Lastly, I'd like to point out evidence of the effect or impact on prices as a result from New Hampshire health costs. A paper that's available to you here, and we provided it to some of you, demonstrates that in the long run, an 11% reduction in patients' out-of-pocket amount was observed as a result of services posted on New Hampshire health cost. This was seen on the supply side of the market. Long-run reductions in prices on the supply side can sometimes be referred to as the sentinel effect. An example of this is providers observing each other and consequently changing their pricing behaviors. Additionally, New Hampshire health costs and price shopping in general can also influence the demand side of the market. And as an example, shoppers price shopping and seeking out lower cost services is an example of demand side effects.
Let me just
I have a
interject.
question.
Oh, yeah.
I have a question. Yeah, so I'm just curious. We all know that prices have been going up. So are they actually going down, or have the prices that when you're citing here, have these prices just been moving up at a slower rate than, I don't know, the general medical inflation rate? Like, how do you measure that? Are they actually falling in real terms?
Relative prices, so the price that a patient would seek for any given service is going down if that service was posted on health costs. So the way that it was modeled in this paper, I think you'd find this interesting. The way it was modeled in this paper is if a procedure got posted to health costs within the next 4 years, the average reduction in patient cost burden was down by 11% compared to its counterpart if it did not get posted on health costs.
I see.
So it's an empirical model that shows the effect of making these prices transparent to the patient, to the consumer, that if we make them transparent, it would exert a downward pressure that in the long run would have substantial implications on price reduction.
You said that there's a paper right there, right?
There's a paper.
All right, cool. I'll grab that and read it. Thanks.
I'll get it for you, but
And if
Let me
you
just-
have a few days where you don't have anything to do, you're going to enjoy that reading.
Thanks.
let me just.
Pass them out.
Sure. Let me just mention that, in this paper, they identify two driving factors, is what we're saying. That in two ways in which health costs has reduced prices. One is by influencing the supply side, the provider of services, and that's where we make reference to the sentinel effect, which means sort of you don't need that much actual shopping for the providers to react on their own and anticipate and compare themselves to other providers and respond with the change in pricing. So that's sort of the way transparency can have an effect on the supply side. And then on the demand side, it's simpler. It's like consumer shopping for the lowest cost MRI and actually saving money.
Calabro has a question.
So I understand we're looking at health costs, but having been in QA for Harbor Care, what are the parameters other than patient feedback are you getting to measure that quality assurance? What are the variables?
Thank you for the question. That is, I'd like you to explore that so you can see the number of parameters that are listed under the quality of care, but they all are patient satisfaction qualitative surveys that are used to inform that. We're constantly looking for ways to improve the quality measures that we use and the precision of our price measures, and we seek to do that in many different ways. Yeah, all right.
Well, my last time I checked this, and it's been a while, but there was reporting outcomes, but it did seem, I know I was looking at my hospital for a particular procedure and it didn't have such a great outcome. And my concern was that because it's a smaller hospital, it doesn't have as many procedures. So you're apt to, one bad event can skew the numbers. That's still true? That's still being reported, those?
That's always true in all statistics. A low frequency of any parameter, so a low frequency of procedures can bias results in many
Right.
ways.
So can I still see that outcomes on your webpage? Do you still have that?
Yeah, the outcomes are qualitative in nature, self-reported qualitative.
Qualitative,
outcomes.
right.
Yes,
So
yes.
that. Okay. Yes, Representative Spear.
Good morning. The database appears to be pretty impressively extensive. But as you know, we've been hearing bills regarding drug prices as well as health care. And you mentioned that and in here, you talk about the fact that you have drug prices. What I'm wondering is the details as to what went into that drug price there, like the wholesale costs, the PBM prices, the kind of money they take in versus the money they take out, all that sort of stuff. Is that available?
Thank you for the question. Another great question. So New Hampshire CHIS, which is the data used to power health costs, uses empirical medical claims data. So none of that market data is available in the CHIS nor expressed in New Hampshire health costs.
Representative Gibbs.
Thank you. I'm going to phrase this as kindly as I can. Could you tell us why, when I tried to test the public-facing database where members of the public could check costs of certain procedures at hospitals, the results seem to bear almost no relationship to reality. And I'll tell you very briefly what I based that question on. It was based on a procedure that I had myself in August of 2021 in Concord Hospital. And the bill, which I got, because Medicare and Blue Cross couldn't agree as to who was responsible, and eventually they sent the bill to me. The bill I got was for $37,000. The procedure was referred to by my doctor as repair of a hiatal hernia. So I tried to find that procedure in the insurance department's system, couldn't find that, found the closest thing that I could, and the prices ranged from something under $10,000 to something around $21,000. As I said, the actual bill that I got was for $37,000. So again, my question is, why did the results bear so little relationship to reality?
Thank you. And that was a very kind way to ask that question. So, identifying prices for an encounter at a healthcare provider, or even just a doctor's visit, is inherently difficult. There are a lot of other ancillary services that are involved with it, and various case mix intensity or patient complexity to those services. And providers are well aware of this. They've communicated that to us, and it's one of the biggest challenges with gleaning precision and accuracy in these types of websites. Our colleagues in Maine have a very similar website and suffer some of the same anguish and not so kind questions with their legislature too. And so we look to narrow that down, but it's a good question. I think it's important to understand what health cost is and what it is not. It's not similar to a price tag in a retail setting where you can just look at a price tag and understand what the absolute price for that product or service is. Rather, it's a way to get a sense for how much a certain medical intervention or medical procedure might cost you. There are a lot of factors that affect the variation in the delivery of those estimates. And that was the primary purpose for us coming here, is to help you to better understand what it is, what it does, what the source of the data that informs those price estimates are, and so you can be more informed to make some of these important health policy decisions that lie in front of you.
And, also one of the challenges is determining the shoppable services that we're going to list. So your procedure wasn't listed on our site. We have some 250 now, and the federal law on transparency aims at 500 shoppable services. Even if you're up at 500, it's going to sometimes be difficult to find that service on the website that matches well with, what your own experience is.
Okay, yes, Representative Phelan.
What is the approximate number of site hits that you get per year to your website?
So I listed here 250,000. I think it was last year that we recorded over 250,000. Yeah.
So in terms of legislation that we have in front of us, we have the one that related to that federal postings, and you have here a .gov listing here. And then they were saying that some hospitals weren't in compliance, so they were not using this particular list, what the federal government list is. I'm trying to figure where it was. The CMS list.
Their list of 500 shoppable
Yeah,
services.
So I assume all our hospitals are on this list, or that legislation which said if they didn't post, then they get it for free. I just wondered whether do you guys look at this list and make sure all our hospitals are on there? And
what we're doing, we have assumed responsibility for enforcement of the part of the federal legislation that governs health carriers. So there's that rule called transparency and coverage. And we've responded to the federal government that we are assuming responsibility for enforcing the posting of those prices. We do not have responsibility for hospitals pricing, although we have plans for using that information to supplement health costs.
Okay. Supplement, okay. All right.
That means hospitals don't have to put their information in?
You need a mic, but
There's
so
a
the-
different enforcement entity, not the insurance department.
So there is a federal enforcement, yeah.
Yeah.
Okay, we'll get to that issue. Yes, Representative Ammon.
Thank you. Does New Hampshire Health Costs provide machine readable files? If you're assuming responsibility for the carriers, that's one of the requirements I read here.
No, that's for carriers to post on their website, and so that's not on New Hampshire Health Cost.
Just a follow-up question.
Further question?
Are there, as the data comes in, are there any like quality checks to see if something is out of the norm, and that it could
Yeah, so we've been
highlight that
working
to you?
with we've been working with CMS, and they have a validator tool that is used to validate the fidelity of the submissions, and so we're planning to be using that to confirm that they're in material compliance with their submission of those data.
That's for the new federal requirements for price transparency, but we also contract with an entity for our own all-payer claims database to do a validity check on the claims data that we get from the carriers. And that just happens routinely.
Okay, so then, so the sidebar to this is now, Representative, I'm sorry, I didn't see your hand up. Representative Walsh.
Thank you. How often do you update your data? Is it daily, weekly, like to add procedures or to add prescription drugs?
All right, so
et cetera?
I want to make it clear, the CHIS data gets updated, we get quarterly uploads from our vendor for the CHIS data, and then we just did on Monday the quarterly refresh on New Hampshire Health Cost. Generally, every quarter, we add somewhere between 15 to 18 new codes, new procedures onto health costs. So that number, the number of services listed there keeps growing. And so you won't find all procedures in the CPT code book, which there's tens of thousands. You won't find those on any price shopping website. Yeah.
Further question?
Thank you. So you're relegated to CMS, so you can't do anything other than in a 3-month period. You said it comes in quarterly.
That's just our process. Because medical claims, sometimes there's a latency to the development of one medical claim. It can sometimes take weeks, even months, for one service to fully go through a claims process. So probably the shortest tenure for that would be a quarter. If you made it monthly, you would have fragmented claims coming in. So how we process our medical claims and get them into one database that's done on a quarterly
Right.
basis.
Maybe I'm not saying this correctly. I'm not talking about the claims. I'm talking about adding procedures, the list of your procedures and the list.
Yep.
I mean, I realize they're
Given-
integrated with claims,
Yeah.
but just
So-
to add like a new procedure.
Yeah,
or a
so
procedure
given that we
isn't-
use the medical claims database to inform that process too, it's relegated to taking on the same timing because there's an exhaustive process that we use to go through and identify these 15 to 18 procedures. They have to be price stable. There has to be a sufficient frequency of them. They have to be there's a contextual part. They have to be of public health interest, right? So there has to be a certain set of criteria that are quite objective, actually, that we use to ascertain with our existing data as it stands what makes the grade, what gets there. I do understand Representative Gibbs' frustrations about not being able to find your procedure or sufficiently precise cost estimates for it, but in its absence, we'd be guessing. We'd have nothing to refer to identify what might be some of the approximate costs for this procedure that I'm about to decide on or endure. So three months is generally a short period of time for that to evolve into something that's utilizable and something that we do our due diligence to make sure that we have as precise as possible estimates. And it's not always sufficient, but it's necessary.
Representative Porticelli.
We've been discussing prescription drugs a lot. So do you have, I'll try to put all my questions in one. Do you have a site or a navigation to your site so we could look at changes in prescription drugs or costs? And is it possible to collect the data that we're looking for related to wholesale, retail? And are you collaborating with any other entities like UNH that seems to also be collecting this data?
So in the CHIS data, there are many variables for prices of prescription drugs. That's included in the prescription drug file, but there's also a robust set of data in the medical claims file for these new classes of specialty drugs that are delivered in medical settings. So those exist there. Right now on health costs, we pulled the prescription drug estimates off for that very reason of price instability, because they're wildly variable across service types and providers. And because it didn't meet our criteria for putting a stable price estimate up there, right? We have criteria for price stability, and we found it to be the more responsible decision, yet a difficult one, because that, as an example, is of public health interest, and it's of legislative interest too. So nobody more than us would like to have robust data on health costs for prescription drugs. But because of the price instability, it's taken off from there right now. Yeah. It's a good question.
You need your mic. Yeah. Sorry, microphone.
The second part of my question was collaboration with other entities that are trying to collect this data. And I don't really understand about the prescription drug costs. So I think that would be very informative to people that wanted to check their
Thank you.
very
And I wholeheartedly agree with you. It's probably the most pressing public health issue in our work right now that we'd like to help better inform legislative bodies on. There are multiple complexities to that, and we do collaborate with other entities, and that process is ongoing. Yes. Yeah, thank you.
So, oh, okay, Representative Terry.
Thank you. Did you want to ask your question first?
I'll wait.
Oh, thank you. I'm still back on Representative Gibbs's question, and I'm wondering about the practical value to consumers. When I hear Representative Gibbs, and if I'm incorrect, please refresh my memory, that you went on the site and you saw a range of $10,000 to $21,000 for a hiatal hernia repair.
They didn't actually have the procedure.
So, all right. So, and then I heard you say that it actually cost you $37,000. So if you would be willing to take this on as a case study to help us better understand how a consumer goes to the site, sees 10 to 21,000, then ends up with a bill of $37,000. I have heard you indicate that, well, there are other ancillary or supportive services that may go into the $37,000, which once again brings explanatory value to the difference between the range of 10 to 21 and 37. But then reverts to my initial question, which is of what practical benefit in the final analysis is a search for a particular procedure when the range is 10 to 21 and it ends up costing 37. There needs to be some explanation here, drilling down and exposing the difference between the 10 to 21 and the 37. Yes?
Yes.
Yeah. Could you respond to that, please?
So, yeah, it's
you.
one of the biggest challenges in bundling a package of healthcare services. For example, a surgery for a hiatal hernia is in a hospital, and presumably a hospital stay is involved. So right there you have facility charges that can range from 1 day to 7 days or even more. And so that's one not trivial example of, yes,
Variable. Yeah.
variable.
And I think it's important, it's important, Representative, to understand that you can't just find the closest billing code.
Yeah.
Adding an extra word could change the billing code range. You need to look at is the bill
Well,
cost the same
and
as the
can't hear what's being said.
He's
And-
saying, okay, you have to talk to a mic. Unfortunately, she has hearing issues. Al can say it.
Okay,
You-
and then
you-
I have a little more relevant.
But you want to say how many days you were in the hospital that day for this procedure?
Okay, this was the problem. I stayed overnight, but technically it was outpatient surgery. That's why Blue Cross and Medicare couldn't agree on who was responsible for paying it. So I stayed overnight, but technically it was outpatient surgery. I can't
So
explain.
hence the extra 10 grand is that you stayed overnight.
Excuse me?
The extra 10 grand was that you stayed overnight,
The extra,
theoretically. In other words, you stayed overnight, so the hospital billed for that extra night. The insurance company says it's supposed to be outpatient.
I don't think that was it. That at least according to what they said. They
Okay.
said it was outpatient surgery, even though I was there. I actually stayed overnight.
Outpatient surgery is what they expect it to be.
No,
but that,
no, it was all planned in advance. It was
that you were
all-
going to stay overnight.
Yes.
Okay.
But because under the billing codes or whatever, this is not something I can explain.
Right.
Under their system, it was considered outpatient surgery, even though everybody knew from the get-go that I was going to stay overnight.
Got it.
Okay,
Representative Terry has another comment.
May I-
guess.
Follow up,
Yeah,
a
yeah,
fo-
yeah, yeah.
Did you want to finish or?
I just wanted to repeat
quick
the
follow.
commissioner's point because he wasn't able to be near the microphone. But
Yes.
his point was that the most important factor here is that the procedure that Representative Gibbs underwent was not any procedure that was listed on health costs. She had to look at something that she determined to be similar, but that's not a reliable methodology. In order to be confident about what's posted on health costs, you have to actually have that procedure or a bundle of procedures.
Follow-up
listed.
question?
I'm not finished.
So which one should go first? The one who still has been doing
Well, I
this? government-
yielded to Representative.
I know. And see what trouble that gets you?
Well,
Okay.
Because
I
once you give her the
I
mic,
now
she ain't going to
yield
give it
back.
up lightly.
Can you yield back?
I yield back.
Okay.
I am
Now,
confused.
Representative Terry.
Thank you. So, so if the range is 10 to 21 and the patient's experience is 37, what I'm hearing is that there are a variety of factors. There are variables. So you can't, as you said in your initial testimony, you can't put a retail price on something like if you want to go buy a book on Amazon. So there are a variety of factors, and we understand that because this is a complicated healthcare procedure. It might involve a number of days, certain types of anesthesia, certain other kinds of ancillary services in order to treat the patient. All right, understand. So if this is the case, do you provide a disclaimer? I've never visited the site because I've never had to do this. A disclaimer that indicates this is in effect a rough estimate, a range, and a rough estimate. Your actual costs may not, in actuality, are likely to be significantly different than this range because of a multiplicity of factors such as yada, 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 yada. Otherwise, back to my initial question, and that is, how is this ever going to be meaningful to a consumer when there are these multiple factors involved that can skew the range of 10 to 21 to as much as 37? I'm trying to help consumers here who want to find reliable information. Is there a disclaimer? Is there not? And would it be helpful if there was? Because that's effectively what I'm hearing, that because there are all these other factors, the consumer needs to know that it could be a lot more than that. Okay, thank you.
And the commissioner would like to.
I think
respond.
that's a point, and we talked earlier about how reliable the estimate was, and so for some of those factors, we have a lot of billing events. We're going to have a very reliable number, and that range is going to be narrower. For unique services that there aren't as many occurrences, the range or where the acuity is more severe, the range is going to be bigger, and you're not going to have the same reliability. And that's some of the things that we balance when we're looking at what services to add to health cost. Is we want to put services on that have the best value to or the best use to consumers in New Hampshire.
Reliability.
Reliability.
Thank you.
Okay, now Representative Gibbs.
Thank you. First of all, I want to thank Representative Terry, who very clearly articulated the point of my original question. And then my question to you is, considering that it appeared my surgery was not a particularly uncommon type of surgery, because my doctor was very experienced in it and had a whole robotic system set up for doing that particular type of surgery, why wasn't it on your system?
So one of the criteria we use to ascertain should this service be listed on health costs is the frequency of that procedure. So not all procedures are on there. We generally put them through a litmus test. We identify about 100 to 120 procedures each quarter and then do descriptive analyses on them. We analyze how frequently have they occurred, how common were the set of codes, service codes, across all encounters, how consistent are the bundles is what I'm trying to say for that, and what's the price stability. And if they don't meet that criteria, we don't add them to health costs. So the ones that you see reflected on health cost have met that criteria. They're produced at a certain amount of frequency. They're very common in terms of the conventions used to bundle them, and there's price stability. And so it can be frustrating to look for this procedure that you're going to have done and not have it there and wonder and call into question the utility of it. And we have those frustrations too. But at the same time, we do a lot of background work to do our due diligence to make sure that the estimates that get up there have at least some homogeneity to them. They're similar in price and they have frequency. They're stable compared to others.
So before I take another question, but wouldn't it be possible that you would do a range to have the high and low also listed? The worst case scenario and the best case scenario, that even though you say this is our average or just statistical mean average or whatever you want to call it, but that you say, but by the way, there's a potential this procedure could cost X amount, the high versus the low. And
I mean, in the examples that I use, what you do see a range. And that's a range of the procedures that have made it onto health costs. These other procedures that have not been stable to make it to health costs, their ranges are much more variable. We use a measure that I was reluctant to get into more statistical jargon, but I'll talk to you, right? It's called kurtosis. It's how narrow the range is. So we use kurtosis as the primary measure to ascertain whether or not it's going to be on there. Something that has a really wide range, it's just not stable enough.
Yeah, but it exists.
Yes.
That's all I'm saying is that it. Again, I'm not an expert on statistics, but that if you had your mean and you have your average, but then you would say the worst case scenario, this is how high that number was.
Yes.
And the best case scenario, this is how low it was. Not saying that people did, but at least then someone can say see their number somewhere near that high, then let's say, oh, okay, so obviously there was more to it with my particular situation.
Yeah.
Something to consider. Would you believe?
This wasn't a question. It was more or less speaking directly to Representative
Okay.
Gibbs and trying to help expedite this little part. Your procedure is really rare. It's not something that happens very often. And so having that kind of measurable data in a database is just not going to happen.
Fair enough.
There are a lot of things. Okay.
Representative Philo.
It's somewhat related to that. What is the minimum end that to even be listed on the database?
It's expressed in this coefficient of variation. I didn't want to get into the statistics, right? It's expressed in the coefficient of variation. So how you measure that is the standard deviation divided by the square root of the n. So that's how it inputs into that. And so the more widely variable ones are inherently imposed to lower frequency of procedures.
Right, but do you have a minimum to even be triggered to be on the database?
I think it's 30.
So is it possible then that you may have some procedures that are so rare as to not even be listed on the database, and therefore a consumer is going looking for it would not find what they're looking for?
Yeah. And that's why we're proud of this new federal legislation, because they can get that information now from hospital providers and the carriers with these new transparency and care
And
laws.
one more follow-up.
Okay.
Would you say it's accurate that your database is more of a guide to a consumer rather than being prescriptive to a consumer as to what their cost is going to be?
Yes. There's extensive language on the website describing how the methodology that we use. If you've seen that, it would answer a lot of questions, but also the limitations of interpretation of the price estimates that you get, that this is just a range, a suggestion. For a more precise estimate, call your provider or your insurance company. And we emphasize that language.
I still think you should put the high and low in.
Yeah.
You know, just so when someone, because most people aren't going to look, they just look at the number and, you know, so, but at any rate, Representative Hammond.
Thank you, Mr. Chair. I just want to say I appreciate your presentation, and I being a database person, I understand the challenges involved with taking this disparate data and trying to make it consumer friendly. And what I'm hearing is that over time, this system is going to improve. We're going to have more and more transparency, and then that will have a benefit to the marketplace and the consumer. So thank you for trying to explain this to us.
Thank you. I appreciate you too.
Okay.
Thank you. This is going to lead into our next subcommittee, this question, but do you feel that there's added value to the Prescription Drug Affordability Board, to the CHRIS database?
We don't have a position on that. I think to the extent that
Put the mic on your.
the department has no position on the PDAB board. We're fortunate that Jason was appointed by the governor as a alternate member of the board. Obviously, our position on getting information out to New Hampshire consumers is critical. I think good data that people can use is helpful. Some of how we deliver that and how that information gets out to folks, that's for you to decide.
Okay, well then I want to follow up on that, and that is, given that we have a statutory requirement of the MRA, if I got the right, the 10%. What is that? Is it called MRA? The MLR. Okay, so this is really important for everyone. This was passed on the Affordable Care Act, or Obamacare, whichever you want to call it, and that is that it limited in terms of premiums. That it limited the premium setting. It's a 3-year look back, a 3-year average of what the medical costs that an insurance company incurs. So that means all the pharmaceutical bills and all the doctors and hospitals and everything is all compiled, and then they cannot charge more than 10% over that number for that premium. So that means in that 10%, it's going to be their profit, it's going to be their advertising costs and operating costs, and all that stuff has got to fit into that 10%. So the reason, what I'm asking is, so when it comes to this affordable, you guys actually do know exactly how much a pharmaceutical costs, and do you see all the rebates and all the kickbacks and all that money that's going back and forth, so that when you determine the MRA, you really are getting a good number?
So MLR. is first
MLR,
off,
sorry.
And I think it's typically 15 or 17%, not 10.
I thought it was 10 and
Just
15.
to clear the
but-
record there. And I think we would see final digit numbers. I can't say for certain that we at the department get to see total rebate dollars for prescription drugs. I don't think so.
So how would you be able to, who does the MLR then?
Well, we're doing it on total medical spend across their whole book, whether or not they're using a PBM, and what that actual cost is. Though you're not, obviously we're talking be hundreds of millions of lines of data if you were looking at every rebate for every prescription drug. So
So the question is, could there be something that's going on outside so that the MLR is not truly reflecting how much it's costing that insurance company for pharmaceuticals.
No, I don't. If I understand your question, if the true cost of pharmaceuticals is factored into the MLR.
And that true factor includes rebates and coupons and everything.
And I'm not saying that nobody's ever messed that up because they have. They're complicated formulas, but it should be completely represented.
Right, and therefore, when you set your pricing, you're looking at all those things. Or are you looking at just the? I mean, I guess the whole purpose of this pharmaceutical board, affordable, was that the assumption that there's some funny money going on behind the scenes.
Okay. Well, maybe I misunderstood that. I thought the whole purpose of PDAB was so that the board could give some direction to the state payers for what they should target for their prescription drugs.
No, the purpose was that the assumption of that board is that there is something funny going on behind the scenes, and they want to know what it is, and that way they can suggest that we would pass legislation to stop it.
Maybe we should move on to 172.
Yeah.
Okay. Okay. Is it Representative Spear?
Thank you for giving up. My understanding, based on what you've been saying, is yes, in fact, you do know the total price of drugs. And you can say that this drug cost this amount of money, and that's what the insurance company paid for it, or didn't pay for it, or covered for it. I think what the PDAB is trying to do is go below that, much more into the details of who's getting paid for what. Because if, as we've been hearing, is a lot of interaction between the wholesalers, the PBMs, and the insurance companies, and feedbacks going back and forth and everything. But I didn't get the impression from what you were saying that those level of details were in there, that you were talking more about the total cost of the drug. Is that true?
I don't believe we get data for rebates. We get wholesale cost, and then ultimately their analysis done for MLR, which is total med spend.
So that's a total. So you can't test it by looking at your numbers.
Well, I can't extrapolate from that
Right.
if or not there's a
For any
rebate or
particular-
not.
Okay.
But we
You get the total. Okay. Representative Burrows.
I had nothing to say.
Oh, I thought you, okay. All right. We all set? Thank you very much, gentlemen.
thank you all.
Thank you.
Okay. Now let's go into our subcommittee. All right. Brief recess.
No, we can listen. We can talk to you. We can't go. Right. It's good for us to have all the information because when we finally call the name of it, we'll have to call it.
Yeah.
All right. Okay, let everybody take their seats, please.
Are we having fun yet?
Yes, we're having loads of fun. All right. So we'll start out with House Bill 172 relative to investigating potential redundancies between the Prescription Drug Affordability Board and the existing state agency programs regarding prescription drug cost data. So I just spoke to the, not the sponsor, the anti-sponsor, the opposite side. And I agreed that we'll just retain this so that we can understand better what the intent of the bill is, since maybe we don't have the same perception. But I want to go on record that I would just assume, if I were to pass something, I would have just assumed to remove the assessments on these companies, on the insurance companies in particular, because it seems an oxymoron to me that if we're trying to lower health insurance costs, why would we then be adding a new tax onto insurance companies? Having said that, I would say that if they need money, they should go to finance. It should be in the governor's budget, but I guess maybe Tom, the governor doesn't answer your phone calls, maybe. so maybe that happened. So, but be acutely aware of that maybe there might be some past issues there. But I also have to admit I was a little shocked that AARP is coming in support of this bill and supporting this commission when they're the ones who own their own insurance company. They have their own insurance product. So you would think that AARP could get all that information, that so-called black box, from just calling up U.S. Healthcare, their provider. So, but notwithstanding that, I know that the legislation was originally initiated by New Futures, and I know that they're a private foundation with oodles of money, and so therefore I think that if they really want to do this impartially, those two entities should help fund, or they can go out to other funds. So I have an amendment that just simply to remove the money and to just have the money go through finance, if we're going to do appropriation. Otherwise, create a fund so that people can make donations to it. Notwithstanding, I've agreed to retain this bill.
Mr. Chair?
But I just want you to know that's where I'm thinking about when we get to it next spring.
Do we not need a vote from the subcommittee on whether to retain?
Yes,
Okay.
I'm recommending.
Okay, because you said I'm retaining, so I
No,
misunderstood.
In the very old days, when retaining was originally created, when the retaining was originally created, the chair could just unilaterally say, from the sense of the conversation and where I think we are, that retaining. But obviously, there would have to be a conversation. You can't just say I have a sense. Pull a sense. I'm not that sensitive. No, right? So if it sounds like I'm dictating the retaining, no, I'm assuming that everyone would be comfortable with a retaining motion.
You want to ask if there's any discussion from anybody?
Oh yeah, no, I haven't
Okay.
made a motion yet.
Okay, you're not
I
there
haven't
yet.
even made the motion yet. We haven't. I don't even know if I have the subcommittee worksheets. Who has the subcommittee worksheet?
Terry Post.
Okay, you have the subcommittee worksheet.
That's the
Somehow-
first time I had.
First time I see it. Okay. All right. So the subcommittee is Representative Terry, Post, Purcelli, Hunt, Calabro, Vincent, Sullivan, and Burrows. That's the old list. Oh, okay. I thought I had a pen. Oh, here it is. I have a pen. I got a pen. Okay. So on this one, Vincent is no longer on it. Right?
Vincent's on it.
Oh, Vincent.
Gibbs is on it.
And Gibbs is, I thought, Sullivan is no longer on it. Gibbs replaced.
Right.
Okay.
That's right.
That's right. Okay. am I all correct? Is everybody else the correct list? It was just those two that I switched? Okay, I gotta talk to Carrie about that. Okay. So, I move to retain. And do I hear a second for retaining? Okay. Okay. Any discussion on the retained motion? Hopefully I can still do parliamentary process
Move that
properly.
we vote, yeah.
Okay. I see no discussion on the retained motion, so all those in favor, just raise your hand. 1, 2, 3, 4, 5, 6, 7. Okay. Pass 7-0. Okay. Moving right along. All right. Relative to insurance coverage for pain management services. All right, so I'm now crossing out Sullivan and replacing with Gibbs. Okay. Yeah, I'm gonna have to pull it out and make sure this is the one that's got everything under the sun, right? Right. Right. So, given that a lot of insurance companies actually do cover some of these things, and A, and B, that for us to cover things, why did it do that? You must have a mouse in your bag. And given that we have some things here that don't even have credentialing, yoga has credentialing? Right. Well, I used to say that. I mean, I go back to it was LADAC, licensed alcohol and drug, that they went 1 year they went to eDNA to get licensed, because they were a new thing. It's a new kind of mental health that came out of nowhere, and so they went there and got licensed, and then the following year they came here for us to give them third-party insurance reimbursement. And I always said, so do I go to the eDNA and say, don't license these people because they'll be running up to Congress the following year? So the question is there really anything we can do with this bill? It is a health insurance mandate, which generally most of us are a little, that's adding more health costs. I think one point in time, Tyler Brennan, who's no longer here with insurance, but he said it was about 5% mandates. Mandates were about 5% of the health insurance costs, which is, in the scheme of things, not much, and certainly not as compared to pharmaceuticals as they are now. But that the idea of adding, going through this when the marketplace seems to be picking these things up. So, Representative Spear.
I just have a question. Could we do anything with acupuncture? Because that seems to be the thing that I've been reading about the most.
There is there are some insurance companies now that covers acupuncture.
Yeah, but it's a very limited basis. And for instance, if you're on Medicare, you can only get it for back injury. There's only a couple of things you can get it for.
Appreciate you bringing that up.
Okay.
So remember, when we do these health insurance mandates, we're only covering about a third of the state's population. Okay? Because anybody who is on Medicare or Medicaid or an ERISA, employer provided package, they are exempt.
But John, what a lot of companies do is say, if Medicare only covers for back, that's all I'm going to do.
Having sat in this seat longer than I probably should have, but I would say that it's an interesting trend what happens with companies. And one of the big companies that I really follow is the state employees. And I'll never forget when we passed the coverage for family members up who were under 26. And the law used to be that insurance companies would keep them on as long as they were in a full-time academic program. And then there was some, like, if you go to beauty school, that wasn't included, and that, so we got the pushback on that. So when we ended up passing, that mandate get passed, but the state employees didn't. They didn't have it. So every time I would hear somebody complaining about it, I knew exactly that they were where they were coming from, because that was one of the few entities that. But eventually, once the Affordable Care Act was passed, that now is across the board, and covers even ERISAs. ERISAs can be very creative. Large employers, ERISAs, they can be very creative in doing different programs. But that's usually union generated if they have a union job, or it's generated that they really want to do that for their employees. So, but again, that we don't regulate that. ERISAs are federally regulated. So that in general, we try to very limit the amount of things that we do. In this bill, if you look at the way the bill's written, and I'm not looking at it, but I'm sure it's going to be in different sections of the law. So it's the small group market, and then it's the non-group, or what we call the individual market. The marketplace as we know it today. So that would be the next paragraph, that these are the different paragraphs it would cover. So I'd say at this point, I mean, we could retain it and talk about it and say there's something we want to pick and choose, but I'm not sold on that any insurance company won't offer it if there seems to be a demand or desire for it. Representative Terry.
So having heard your recommendation, Mr. Chairman, or your suggested recommendation, one of the things that I have mentioned to colleagues when they've asked us about our committee process is that when we get to the subcommittee level and they hear what the feedback is from the committee, that they would have an opportunity to respond to that, not argue, of course, but to appeal. I'm wondering if Representative Nagel is here.
Yes.
I'm wondering if he has any thoughts based on what he has heard.
So please come up to the mic.
Because I'm sort of, after having talked with him, I'm sort of inclined in being favorably disposed, not necessarily to favor the bill, but to retain it for further information. So thank you very much.
Yeah.
Thank you, Representative Terry. Thank you, Chairman Hunt. You pretty much took the words out of my mouth. There is a parallel bill that we're seeing in Health and Human Services to create a committee to discuss this bill in greater detail. We've met with the insurance representatives. We've met with all the providers that are involved in this issue. We acknowledge that there's some issues with this bill, but we think that as a group we can work on it together. Therefore, we would like to retain that, proceed in that way, and then get back to you.
Yep. Representative Calabro.
I wanted to move to retain it. I was talking with Dr. Nagel, and the elements that were problematic, I think, can be ironed out.
Okay. So, great. Thank you. So is there anybody else in the audience who thinks differently about retaining? Okay. I always have to ask that question. Okay. So, Representative Calabro, seconded by Representative Terry, moves to retain. Any discussion on the motion? Yes, Representative. Is there a deadline here? Okay, so retaining bills means that we will be discussing them in the fall, and that we would have to have this out of committee the last week of October, excuse me. Anybody have a calendar? You can see what the date is, but it's usually the end of October, and that means it will hit the House floor the first week of January. So that's 1 week you don't want to miss, because all the bills that were retained will reappear that first week. Because it's always funny because Ed Butler would always go to New York that week, and I said, why would you miss out on that week? But so Representative Purcell.
But if there is going to be a commission to study this, is that what I heard? A committee, oh my goodness, a committee to study this, wouldn't we need the outcome from that committee to?
We
have
would be,
as
we would
input?
be interested in knowing what
will
happens.
they
So
have
are they
their
turning it into a
results?
chapter study, or what are they planning on doing? What kind of a committee are they talking about? There's two kinds of committees, or there's what we said. A is retaining an interim study is technically a study committee, but we keep it in the committee. You can do a chapter study, and which generally the chapter studies would include legislators, House and Senate members. And we generally say you don't want to do that the second year because that would be campaign season and nobody wants to show up. And the third thing is a study commission. And that way you get participants from the different constituents who would be involved, and they all have input. I always say that over my years that study those commissions is the best way to really make sure nothing gets done, because everybody's got their own axe to grind, and so over my years I've only did that once, and that was over a privacy issue.
So further clarification on the committee.
Yes.
And who is the makeup of the committee?
So what is it you
On
guys
our
are working
committee,
on? What
the
are you guys?
committee will have, I'm sorry, Representative Merchant is the reason I'm the passion. So he has all the details on that, but it's, there were going to be 2 senators, 3 reps. We pretty much already discussed who
Right.
those people would be. The plan would be to meet this summer, have something to you by the fall.
Right. So that's a chapter study committee. So, so theoretically, their results wouldn't come out until the same time where we, actually chapter studies get an extra month. I think they finally can report in December, but, so theoretically would be parallel to that. So we would be waiting to hear if there's anything came out of it, and then we would could take it up in our subcommittee.
With that said, we're all one happy family now, so this will be an ongoing discussion anyways. So
Right.
informally.
Okay. Everybody all set? Okay, so that's Terry, Post, Priscelli, Hunt, Calabro, Vincent's not here, and Gibbs and Burrows. So all those in favor of retaining, please raise your hand. Okay. 7-0. Okay. Establishing a committee, let's see, bill number 319, establishing a committee to study an all-payer system insurance for hospital services. I guess I need to go get my bills. I don't have I don't see my desk. So who would like to start talking about this bill? So is anybody here for this bill? Okay. Okay, let me go. I don't have this. Okay, so this is sort of like the Canadian model. Is that what this is? Okay, we don't take testimony. Okay, so when we're going to invite you up is when we, in our discussion, we get to a place where we need input. So you have to talk on the mic. You have to come up to the mic. Right. You got to turn. Yeah, red is good.
Be helpful if you could talk with out the
Oh,
mask so we can
sorry.
understand
I have
you.
a newborn I'm taking care of, so
Thank you.
when I'm not working. So Bill 319 is not in reference to a Canadian health system. It's in reference to what's being done in states of Maryland, Pennsylvania, and looked at, but actually Vermont in a different way, is in reference to what's called an all-payer health system, which is very relevant to the what you've just heard testimony from the insurance department. So, by the way, as a physician, I've been on the New Hampshire Health Costs site, and I appreciate the efforts of the insurance department. But what affects people's bankruptcy and affordability are procedures. The only procedure mentioned was an arthroscopy. It doesn't mention common procedures, bypass surgery. It doesn't mention other common procedures that are extraordinary in cost. You can go to a charge master, what the insurance department was able to provide me.
Are you speaking to this bill?
Yes, this is relevant to this bill. So I'll speed it along, sorry. If you go to that health site, you will see huge discrepancies because what was not mentioned this morning is private insurers negotiate separately behind closed doors for those costs. That's why I suppose this is on the Commerce Committee's lap. Healthcare costs, however, you're not consuming having a hiatal hernia repair like you consume an apple when you go to the produce department at the grocery. You are receiving health care. Listening to the Commerce Committee discuss these matters is like putting a square peg into a round hole. It's bizarre. The efforts to try to incorporate all the intricacies of healthcare costs when you have private insurers who are opaque to how they're negotiating costs behind closed doors is bizarre. It's never going to happen, but I appreciate their efforts. So what all-payer system modeled on the Maryland model does is it sets a single cost for every hospital and hospital-associated procedure made by Medicaid, Medicare, and every employer-sponsored insurance. There is one cost per hospital. Not every hospital will have the same cost. Dartmouth, which has a tertiary care center, a neonatal ICU, has different costs and demands than Cottage Hospital, 20 miles away. Each hospital negotiates with a New Hampshire agency, typically run in concert with the insurance department, to set a single transparent cost for every one of those procedures that you folks were trying to figure out this morning. That incentivizes doctors to take Medicaid, so it's not a third-class citizenship. It incentivizes the hospitals to take Medicaid, where they'll try to put these patients on the out of the OR, so you're going to be paid higher by the insurance company for the same knee replacement. It incentivizes primary care, which is a lost leader.
How does it incentivize it?
So the important question, thank you, Chairman Hunt. Right now, hospitals make their revenue, in which they sit on large revenues, as you all know, nonprofit hospitals I'm talking about, make their revenue by seeking out those procedures which give them the most money. That makes sense. But they're nonprofit, they're tax exempt. So that's why you see the advertisements for getting your knee replaced, your hip replaced, having your bypass surgery there. Those are big bucks because they negotiate far above what Medicare pays for those procedures. On the other hand, those same hospitals that have bought out primary care practices, those primary care practices get paid what Medicare provides, 10% more at maximum. So they have no incentive to have you go to see your doctor to discuss your high cholesterol or manage your diabetes or help you motivate to quit smoking so you don't need your bypass surgery because they make more money off the bypass surgery. It is a loss leader. This is the intricacy of healthcare. Why it's before the Commerce Committee
Okay.
is
So
insanity.
you're going to answer my question. How?
No, I just answered it. So I'll answer it again. Hospitals are incentivized to make revenue off of high-paying procedures.
Today, you're saying that's what's going on now.
That is the current reality.
So how does this bill incentivize hospitals to be cheaper?
So that's really important. Number one, it sets a price it helps negotiate what the price is for Cottage Hospital, Littleton, Southern New Hampshire. There's an agency that works with the insurance companies, the private insurance companies, works with Medicaid, works with Medicare, and sets a uniform price for that hospital, which is lower in average to what they are getting paid by the employee-sponsored insurances. It lowers your premiums, by the way. It lowers your deductibles. The data is clear. How does it do it? Go to the total cost of care in Maryland site. It's easy to do. It's on a website. They saved Medicare alone $1.2 billion. This is in billions of dollars. How does it do it? It's set by lowering the cost overall to a uniform level playing field. Medicaid is
so
on
at the end of the day, the hospital cost is going to get lowered.
the price of the service by the hospital to all insurers is identical, whether you're Medicaid, Medicare, or employee, and it is an average
There's
lower.
no way
Yes.
in my mind that they could be using
Well, you should-
Medicaid, because my understanding
No,
is
it raises the price to Medicaid, which is why hospitals are interested in
that
it.
means raise the cost to the state.
Mr. Chair?
Go ahead, you have a question. No, that's not true. It lowers the price to the state. but
Wait a
go ahead.
minute. Okay. How can that be? You can't be both. Yes, Representative Terry, you have any answer
Mr.
to
Chairman,
this question?
I appreciate the colloquy in which you are engaged with the man who's testifying, the doctor. But I believe that the bill establishes a committee to study an all-payer system.
That's correct.
Your initial question, as I recall, Mr. Chairman, was this a Canadian model? And the response at the beginning of the testimony, or the response to the question, since we're not in formal testimony today, was, no, this is modeled after state systems, such as the Maryland system or the Pennsylvania system.
Right. You have to have
So my-
somebody from Maryland.
So my understanding is that
No.
we're not so much here today to debate the merits of an all-payer system as to whether or not we even want to bother to have it studied as to its applicability here in the state of New Hampshire. And I just
Okay.
want to be sure I'm clear on that.
That's correct.
This is just this study. And so if that's the question, then I would have a question, if I may. Who are please refresh my memory, who are the constituent members of the study committee? Who appoints them, and when is the report due
Okay,
back?
I have that list.
Thank you.
I have the Commissioner of Health and Human Services or a designee, the Insurance Commissioner or designee, a physician and member of the New Hampshire Medical Society appointed by the Society, a representative of the New Hampshire Hospital Association appointed by the association, one or more representatives of organizations responsible for reimbursement of healthcare such as Medicaid, CHIP, federal, state, charitable, or private agencies as appointed by the governor, a New Hampshire health policy advisor who has expertise in the Maryland all-payer total cost of care model and other state all-payer systems appointed by the governor.
And Chairman, respectfully, the first part of the membership of the committee includes 4 members of the House of Representatives appointed by the Speaker of the House, 1 member of the Senate appointed by the President of the Senate, members of the committee shall receive mileage, and
Yeah.
so basically, and then the Commissioner of Health. And
Yeah,
so,
just so you know,
Yeah.
so why I did that.
Yeah.
Okay, remember I started out with a study committee would be just legislators and Senate. A commission, which is this doesn't say a commission, but that's what it is. Okay,
you've told us you
because
don't
it
like
then has
commissions.
the whole myriad of interested parties in there. You see
well,
that?
these are no, but these are folks to be called upon for information. The committee is a
Oh, I
House
see.
of
It says committee
Representatives
shall
committee.
solicit the information and testimony from these people.
Correct.
I gotcha.
And we have a
I
date?
did not see that
And
sentence.
do we have a due date for the report?
The due date would probably be the end of the November, due date's November 1st.
So it's my understanding that essentially you'd be studying the Maryland system, the Pennsylvania system, whatever, and whether or not it would have any favorable applicability to the unique state that we are in
Right.
distinction. We have similarities but differences with respect to those 2 states that I just cited.
Correct.
Thank you.
And not to engage in colloquy, but I do think it's worthwhile pointing out that we have pricing failures in this aspect of healthcare. Your premiums may go down a little bit next year because of COVID, but the Insurance Commission has an annual report of the cost of premiums in New Hampshire and the cost of deductibles. That is, you pay $20,000 a year to get your health insurance, but then you have to pay $5,000 to pay for that procedure that you've just paid. So there is a pricing failure that is due to the opaqueness of this negotiations between PBMs as well as hospitals and private insurers. The price is actually determined by this, and as well taken, this will be studied, but the reason prices go down is they are set lower than what they are currently, but satisfies the insurers who are not objectionable to this in Maryland, nor the hospitals who are not objecting to this in Maryland. In fact, they had protection during COVID when they had their global budgets enabled them to weather the COVID disaster for their revenues. So there's a lot of things that are favorable.
Who's went up?
Excuse me?
If it's not objectable to
Nobody's went up.
providers, objectable to, so
Believe it or not,
everybody's premium went down.
It's not a free. It
Everybody's-
actually happens in the rest of the world. We pay twice the cost of every other nation on earth.
So-
Can you lower the price of
Is this
American
the one
medical
you were
care?
talking about that we
Yes.
have high deductibles in the
Excuse me?
state? That we were the highest deductible? Is this the bill that you were talking about? The
Yes,
highest?
we in 2021 we were the second highest
Okay.
cost of deductibles in New Hampshire in the country.
Who do you think decides what the deductible should be?
Who do you think does? It's the insurance company.
No, the employer. The employer looks at the premium and looks at the deductible and then makes that decision how much deductible they want to, how much they think they can suffer onto their employees.
What they can afford
versus-
from the insurance company, right? The insurance company will set the price to that employer
to the
for-
deductible. In other words,
Well,
it's
and the premium, and they're
they're
interrelated.
directly related. Okay, in other words, if I wanted to lower my deductible as an employer, if I want to lower my deductibles to my employees, I just have to pay a higher monthly premium.
Chairman Hunt, you're absolutely correct in what you're saying, okay? What we're saying is that the total cost of health care to an employer or to an employee is set by the insurance company. The insurance company says, look, we're going to make $30,000 a year off of you, Chairman Hunt, either through the premium or the deductible. We can lower your premium and raise your deductible and meet that $30,000 a year, or we can raise your premium and lower your deductible. So what you're saying is, as an employee or employer, I can determine which of those two programs I want. But from the insurance company, they don't care because they're making the $30,000 a year off of you and your employee, regardless of which plan you choose. So that's set by the insurance company.
But again, the individual.
Thank you. There's
The
another-
individual business is the one who's making that decision.
insurance
So if
company's
you were to
making
say
it
to
for
me,
the
why do
business
we
owner.
have so many? So what you're saying is
There's
that
another
in
issue.
Maryland they don't have a $5,000 deductible?
So there's another issue which is related to this that I want to discuss with you. Medical insurers are actually like a utility. They get the opportunity, the ACA set that they can take aside 20% of revenues taken from premiums and deductibles and copays, all the various tools, co-insurance if you wish to call, all the various tools that a health insurer creates to get revenue from. From that, they must expend 80% of that on actual medical care. So the healthcare dollar actually goes to medical care. The rest of that 20% goes to overhead, to new buildings, goes to profit. The reason that such a phenomenon as all-payer systems lower cost, to answer your question from before, and thank you for clarifying how the insurance companies set these prices, is the insurance companies don't really care very much how much they pay to the hospitals. The fact that your premiums are going up is because of the response that the hospitals are charging more. This is what I'm getting at, and I don't think you're.
No, I
you're
get
quite
what you're
grasping.
saying.
So each year, but just
Yeah,
an
right,
important,
right, can you
an-
stop?
an
Can you stop a
important,
second?
an important point.
Evidently, Representative Terry really wants to
Okay,
step
well,
in here.
but you understand the point that
This is not about me.
So, Mr. Chairman, I just observed that it sounds to me like what we're doing is discussing the nuts and bolts of a single-payer system and its merits or demerits, which my understanding is that this would be the responsibility of the study committee to do, not for this committee to do today.
Right.
And I am particularly fascinated, Mr. Chairman and colleagues, with the fact that the two states that have been cited, these laws have been implemented, have been passed and implemented in states where the Democrats were in control in Maryland and the Republicans were in control of the House and the Senate in Pennsylvania. So this fascinates me and pushes me in the direction of really wanting to learn more about this before I decide whether I would be predisposed favorably or unfavorably to such a system. On the face of it, there are people who are writing to me, people who are particularly inclined to be supportive of me, who are calling this socialized medicine and a Canadian model with all of the disasters stories, anecdotal stories, and statistics we get out of Canada. I think it's premature to call something that it may not be. So I would be, I would appreciate if we could move to decide whether or not we want to even empower a study committee or we just want to kill this thing right now.
And may I just correct you,
fully
Mr.
echo
Representative
what
Terry? This is not a single payer system. There is a bill to that effect. All payer includes all private insurers.
Yes.
It does not eliminate the private insurers. It just lowers costs by making it transparent and the negotiating process. It takes care of the pricing failures that exist with the 80-20 rule from the ACA and the opaque negotiations. So, thank you.
Thank you, and that just
Mr.
highlights once again the fact that there's a lot of education that needs to be done around this so that there can be a greater understanding before we come to a decision. I thank you.
So,
Mr. Chairman.
My question to you, if we were to pass this, and I made sure you're the first name,
Is this punishment?
then you would be chair of this study
Chair
committee.
of the-
Do you want to do it?
You can always become a Dem. Go ahead.
No.
Do you want? Would you want to do this study committee?
Remember, Governor Hogan was the governor of Maryland during all of this time, and he was.
Yes, I recall.
Right, but in Pennsylvania, the legislature's only recently been Republican, so I don't.
No, it's been Republican for the last 2 or 3 or 4 terms.
Right,
They
but
just-
how?
they
When
just-
did it pass in Pennsylvania?
By Republicans.
When did it pass?
When did it pass?
It's been under it was being studied for the past 4 years.
Yeah, no, it hasn't passed in Pennsylvania.
No, it did pass, and it passed, I think, 2 years ago.
Well,
So
I
it's
have to
actually
check that.
right
I may
now
be
that it's,
mistaken on that.
it's law in Pennsylvania.
2
Okay.
years ago, the Republicans controlled the House and the Senate. They just flipped one House in the last
Right.
election.
Okay.
I would,
So-
I would echo Representative
I-
Terry.
What's that? You want to study it? You want to
I-
do it? I'm looking for.
I will
what I'm
support
say is,
Terry.
I'm looking for 4 people who want to do this, study this.
I will
Okay.
help.
So that if you guys are all willing to do it, then let's just pass this and good luck.
I
You're
will
all
help
no. Actually, this is
Representative
great
Terry.
for you guys to learn what study committees, how they work and
This
what
sounds
happens.
happy
like-
to help.
this
You're
sounds-
you're gonna learn first aid, but I
do
want
not-
you to
I do
chair it.
not- I have chairing skills, Mr. Chairman,
Yeah,
from
good,
my past
perfect.
life, but that does not necessarily mean that I'm
you're-
anything like an expert
You're
in the
first
area.
named. You're going to be on it. You're going to be the chair.
Okay. All right.
Okay.
I'm
All right.
honest.
So the motion of Representative Terry,
Just great.
second by Representative Calabro. So we are. Okay. So the committee recommends Terry, Calabro, Post,
Just great.
and who's my 4th? No, I got Post.
Thank you.
Who's my
all
4th?
For looking to advance
Who-
our health.
who's my 4th? Yeah,
We need
I just want you to know what I find insane about this is I've been around too long. So we used to have a law called Most Favored Nation, and that is that whatever the one insurance company agreed to in terms of the contract, then all the other ones got to be at the same rate. Okay. And so we got rid of that because we thought we wanted a competitive market, that insurance companies could be negotiating with each individual hospitals based upon their hospital situation, what's the best situation for them, competing, and which one they could drive more customers to, and then that rate that they would negotiate would be based upon how many customers, how many clients they're going to be sending to that particular hospital, and again, make it up in volume. So if you think if you're telling me that hiring a state bureaucracy, creating a state
it's actually using your existing bureaucracy. I just looked up
No,
on
the
the
website.
website. There are 12 different health bureaucracies.
What are you talking about,
looking at,
bureaucracies?
Wait, didn't we
the
already
hospitals,
decide we're
be the
doing this?
Department of Health. Yeah, I
Okay.
want to
Can
thank
we
you for
just
voting
vote?
on this. By the way, you and I both remember when there was no such thing as a for-profit health insurance, other than
We
there's
have one.
There's Blue Cross Blue
We have one
Shield.
in state.
We remember when there were also such things as high-risk risk pools and such things as pre-existing conditions.
I
We
was around for
remember
that.
numerous things.
Okay, but
And
that's,
so let's
that's
move things.
long
Thank-
gone with 7-Eleven.
Agreed, and thank
Okay.
you for moving.
Who
things
is my
forward.
fourth? You're going to do it? Okay. Okay. The motion is ought to pass. All those in favor, raise their hand. Okay. 1, 2, 3, 4, 5. Those opposed? Who's the sixth? Who am I missing? 5-2. Okay. Okay. What a waste of time. All right. Establishing an interstate compact for universal health care. Okay. So this one runs on the idea, if I remember correctly, that if we just had one insurance product in the New England states, then we could drop the premium by 15%. Is that right? Did I get that right?
So the idea here is it's fairly simple. If we buy healthcare in bulk, we'll get a lower price for it. That's where the interstate compact comes in. We work with other states so that we have a higher population base that we're covering. Our neighbor states, whoever else in the United States wants to join us. And therefore, we're able to negotiate prices with the hospitals, with the pharmaceutical companies, all that sort of stuff. And just sort of centralize everything in one spot, so we get one price for everything. I don't know if it would be 15% more or less, because it would depend on the exact number of states in the compact, the exact numbers. But yes, it would cut costs and save money.
Okay. So, yes, Representative.
I guess my question is, you don't yet have people who have agreed to be in this compact, is that right?
We have talked to folks in Massachusetts, in Maine.
Yeah, but who are these folks? Are they decision makers?
There is currently a bill in Massachusetts that would create a system like this. It's just not an interstate compact. I believe there has been in the past similar things in Maine and Vermont as well, and also out west as well.
But you don't yet have decision makers who have said, we want to do this.
Well, correct. I don't live in other states.
So I'm not clear how we can
This
pass
bill
a
doesn't-
bill establishing an interstate compact unless we have the players at the
You would
table.
be the first. What happens is you pass the bill, and the bill sits there until other states join it. It doesn't go into effect until other states have joined. There's no risk involved for you here. If no one else wants to do it, nothing happens.
Right. And yes, Representative Terry.
So hypothetically, let's say that Vermont and Maine and Massachusetts and New Hampshire were to form in such an interstate compact. What would be the decision-making process? Who would be the players, and what authority would they have? What vote would they have? I'm concerned here that by becoming a party to an interstate compact, but not necessarily agreeing with the other players, that one would have to go along with the majority, whatever the majority decides. And we already know that there are significant differences represented by these 4 states, for example. How do you respond to that?
I mean, at the end of the day, regardless of which side of the aisle you're on, you need healthcare. The needs between, you and any other members of this committee here are fairly similar, regardless of what letter is next to your name. You all need to see a doctor. What the Interstate Compact does is it would establish a board to determine those sorts of things. At the end of the day, they're just making sure that you're able to see the doctors you need to see, to get the care you need to get. You are able to get the drugs you need. This is not rocket science here. It shouldn't be controversial. The intent here is to get us back to sort of the pragmatic, let's just get everyone what they need.
Representative Spear.
I'm realizing that I'm not allowed to vote,
That's true, but you can.
but I can say something.
You can say something.
So there's really, there's really 2 issues with the funding of this. One issue is what Representative Terry talks about, in the fact that if we don't get enough of a base, we're not going to be able to do anything anyway, right? And that's what you've said. The other funding issue is the assumption, which we have talked about, that you are not going to get people from Medicare, and you're not going to get self-insured people like BAE Systems, CNS Grocery, Fidelity. All the self-insurers wouldn't even be allowed to touch this. So what does that leave us? That leaves us a fairly small bucket of people in this state, influenced by people from out of the state. This thing either needs to be reworked, or it's just not tenable. And I'm not going to say anything else because I don't want to drive anybody else crazy.
May I respond to that? It's not a given that the waiver from the federal government for Medicare funds to be pulled into this trust fund.
It most certainly is. I have looked at this in detail. It cannot be done unless we get together with 2/3 of the states of this country, which we have no chance of doing.
Well, we have information that you don't need an act of Congress. You can, as well as administrative orders by the president. Because Ro Khanna from California has a bill which calls for, different from the ACA waiver process, a waiver pathway.
I'm sorry, there are lots of bills floating around, just like this one, pleading with Medicare to do this, pleading with Medicare to do that. They don't accept the bills. Show me a bill that has actually passed and they've gotten money out of Medicare. Now remember, Medicare isn't paid by taxes. It's paid out of a fund directly from the Treasury. People don't have access to that money.
Representative Spear, as I explained to you over email, I believe we don't need a Medicare waiver. What would happen is folks on traditional Medicare, like you yourself, as you told me, would receive a supplemental plan from the Interstate Compact, because we can't necessarily touch that money without Congress changing something, which may or may not happen, of course. We just give you a supplemental plan to cover the stuff that Medicare doesn't cover, and that way we don't need the federal government money because they just keep paying for it as they would normally, and the Interstate Compact would handle the rest.
Then in that case, where are you going to get the funding? The other people that you cannot touch are the people that are self-funded, the insurance companies that are self-funded. They are governed at the federal level. So what does that leave?
Correct. As
to
as
get
I
this thing funded?
as I explained to you, under ERISA, companies that operate in multiple states are required to offer the same insurance plan to all of their employees.
Right.
That doesn't mean that those employees have to use that insurance plan. And if they don't use it, the company doesn't have to pay for it.
All right, I've been under I've been under that kind of insurance plan all of my life,
Mm-hmm.
all of my working life.
Mm-hmm. So have I.
Not once, not ever, and that's older than you. Not once, not ever has
way-
anybody been allowed to opt out of those plans.
The way that this would work is companies aren't going to want to pay for the same thing twice. They have two options. They can and keep encouraging people to pay for use the ERISA plans, or they can encourage them to go on the Interstate Compact plan, which would cost them less. And so because that's a better option for them,
But they can't use it. If you are governed
confused.
underneath, if you are a self-insured company, self-insured like BAE Systems,
Mm-hmm. Yeah.
you must offer the exact same plan to everybody in the company, from
Correct.
the president down to the guy who cleans the garbage, of which they got rid of, so they don't have those guys.
but my point
They
is the
don't
employees
allow,
can
they
choose.
cannot
not-
allow in one state for you to opt out, and in another state where you
No
cannot
one's opting out.
opt out. That is not legal.
no.
So I don't see how anybody in New Hampshire can take advantage of it when they're not allowed to touch it. I'm sorry.
Okay, Representative Burrows, seconded from Representative Hunt, moves inexpedient to legislate. Any discussion on the motion of inexpedient to legislate?
I just want to say, I mean, I think this is a noble idea. I just think that this bill is not ready. I just want it on record that I applaud what you're doing. You know, I think there's, benefit in looking at this, but I don't think this is ready to roll.
Okay. All those in favor of inexpedient to legislate, raise your hand. 1, 2, 3, 4, 5, 6. Who am I missing now? Okay, it's a Calabro. Okay. So I did. Okay. But yeah, because Vincent's not here today. Okay. 6-0. All right, moving right along. Relative to billing for ambulance services. Do you want to just retain this?
Yeah, I would like to retain the ambulance service bill. The more I've thought about it and talked to people involved, I'm actually looking into idea of finding federal or grants for rural that we might get for rural ambulance services. So I'd like to explore that as a possible alternative to legislation. So therefore, I'd like to retain it.
Okay.
So if I understand, Mr. Chairman, so you're exploring non-legislative alternatives so that legislation would not be necessary, but you want to retain the legislation anyway?
Yeah, I'm not 100% sure. I'm saying I'm not 100% sure at this point whether we can find money, but I would like to do so and use the legislation as a fallback.
Oh, so you essentially want to put this on a hold or put it in the freezer in case you want to bring it out later on?
Well, how would you like to do it? You want to ITL it?
No, I'm just asking a question. I just want to understand. This will no longer be your primary vehicle because you're going to be exploring other alternatives that you think may be more favorable.
But I'm
to
saying I
your
don't know at this
to
point.
your objective. Right, so you
Representative
wanna
Terry,
hold it.
if she were to find another source,
Right.
then we would need to revisit the legislation, the statute,
We would.
to correct the statute that would reflect that revenue. Because in this bill was the banning of balanced billing. So
Right.
if she was to find other sources, so they would take care of those ambulance services that are need to do the balanced billing, that if that they have now been satisfied by another source, then we could go forward with passing the bill with the ban on balance billing.
Understood.
That's why she
That
wants to
would be
retain it.
considered prudence by Representative Burrows. Thank you.
Okay.
Thank you for staying included.
Okay, she's back.
Mr. Chairman?
Yes, Representative Gibbs.
There was also another element of this bill, which is something that I think we would want to discuss on retaining it, and that was the requirement that the insurance companies pay the ambulance services directly rather than paying the patient and then having it be the patient who then has to pass the money on to
Right.
the ambulance service, which sometimes happens and sometimes does not happen, which obviously caused a lot of problems for the ambulance services that didn't get paid. So I
Right.
think that's something that we would also want to discuss that makes it worthwhile retaining the bill.
There you go. Okay. All right, so the motion is to retain. All those, any discussion on the motion? Seeing none. All those in favor, raise your hand. 1, 2, 3, 4, 5, 6, 7. Right, okay,
So 7-0?
7-0.
Okay.
All right, relative to provider contract standards for pharmacy benefit managers. So we want to retain this, is that right? We're going to retain this. Okay, so Representative Hunt, seconded by Representative Burrows. Actually, I don't even see your name on it.
I'll second.
Are you on? Am I missing something here?
No.
Okay. All right, Representative Terry moves to retain.
No, you do, and I second it.
Yes, you're seconding the retaining
I
motion.
can't do anything more today.
Okay. Right, and okay, all those in favor of retaining, raise your hand.
Am I on
1,
this?
2, 3, 4, 5, 6, 7. Okay. Getting there. How are we doing for time? Okay. Relative to consumer protection to hospital price transparency.
I really liked this bill for whatever it's worth, even though I'm not on the committee.
You really like this bill?
Yeah, well, I mean, I like what they're trying to get at. I was impressed by the gentleman from Colorado who explained it, how it was working there, and it
Right.
led to a lot of outcomes. I think it's a good idea, and I don't think it runs. I think you had concern at the time that it was a little redundant to what the state's
Well,
doing.
but because we just learned that
Yeah.
there's this CMS.gov health plan price transparency resource. So I'm assuming what we just learned is what they were trying to get at, that those numbers are being posted. Am I assuming
Not
correctly?
exactly.
But I think it doesn't provide like another spot where you can go onto their website and find out this. So it's like another place for this information to be available versus assuming everybody knows about this.
Right.
Mr. Chairman?
I don't have a problem with that. The problem I have was the penalty. Is
Not
that
paying.
not paying? Yeah, that's the problem I have. So yes,
Mr. Chairman, as I recall, I too was impressed with the testimony of the representative from Colorado who informed us that it passed the Colorado House, I believe, 99-1. However, the presentation that was made by the sponsor, prime sponsor, and the supporting sponsor left me with a lot of questions with respect to how this would work and be implemented in New Hampshire, whereas this sounds like I would have voted for it in Colorado, I'm not nearly as ready to vote for it here in New Hampshire because the responses and the information that I received from the sponsor and the co-sponsor left me with a lot of questions. I don't think it's ready for New Hampshire.
Okay. Representative Spear?
If I remember correctly, the bill 389 talked about having almost daily updates to the website, that's a website, to keep, and the accuracy had to be very close. Based on what we heard from the insurance company, the insurance department rather, they're working like crazy and they're trying to get it updated once a quarter. So I don't know, is it physically possible to even do what this bill wants to do?
Right. Well, and then the issue is what database they're looking at. I mean, I assume it's supposed to be maintained by the hospital. Is the hospital supposed to be keeping this thing published?
Well, I mean, I think they were going to be posting all that information on their respective hospital websites so that when somebody was looking to get a knee surgery done, they could go to each website of
Right.
of the local hospitals, then they can compare. I think the part that sounded interesting to me was, yeah, I mean, or what the gentleman from Colorado said with respect to your concern was that I think he said that nobody had ever gotten to a point where they had to take someone to court, and
Yes.
because I was also concerned with that too, and I raised that
Right.
question with him.
That they usually gave him they would give
They
him a
normally
credit.
negotiate.
So it was a negotiating point that,
It was a
you got to give me a
negotiate-
discount because
Right.
you screwed up.
And he said nobody had got to that point because they had figured out in advance how to negotiate it versus going to court. Because going to court is that's expensive on the person bringing them to court too. So I
Anyway,
feel like there was an incentive on both parties to negotiate. What I thought was super interesting, and I know it's not directly the intent of this bill, but maybe an unintended positive consequence of the bill was the idea that there were these apps and tech companies that were popping up to have this information tied to your location. You could quickly scan it, and he said that it had been popping up in Colorado, and perhaps a similar ecosystem could pop up here, which would, no offense and with all respect to the insurance or the presentation we had today, would probably be superior to what the government is producing for us now. I'm just
Well, I
assuming.
could tell you there won't be, because the one thing it can't do is tell you what the doctor or the anesthesiologist or anybody else who's also billing. Because you get separate bill. Those are separate bills.
That's true. I mean, I'm just saying
That's
in terms of
that was the big project we had for the department was we want the net, we don't want the gross.
Mhm.
We want with everybody, all the different providers who were in the room
Right.
when it
Yeah, I
happened.
mean, I still thought it was an interesting thing to have. Like, I go on my phone and I'm in Concord, and what are the 3 hospitals nearby? I need to go get my leg X-rayed after I fell off my bike or something, and you could I mean, that's
That's emergency room. Yeah.
Yeah, and that example, sure, but I mean, I think that's kind of an interesting outcome that he says is starting to pop up in Colorado, and I don't know. It seems I didn't see a huge downside to this, aside from what you
My
flagged, which I was
downside to me
concerned
is the threat that they won't pay the bill at all. And the last thing I want to do is create a situation where that
right. Well,
some technicality that someone's
which
say,
I
"I'm not gonna
agreed
pay a
with,
bill."
and I asked that question of them, but I was impressed by the gentleman's answer from Colorado, which is it hasn't happened there because A, there's a cost to take somebody to court,
Right.
and B, once you get to that point, if you know you're out of compliance, you have an incentive to negotiate with them versus going to court and getting, So I don't know.
Okay.
I mean, I thought that was a good explanation from the gentleman from Colorado. Anyways,
Okay.
that's all I take. I'm not
So-
married to this, but I was impressed by the
Will the
bill.
hospital association like to? No comments from the peanut gallery.
Good afternoon, Mr. Chairman, members of the committee. I unfortunately was in another hearing, so I did not hear the department's presentation on health costs. So when you were citing, Chairman Hunt, the CMS website, I'm assuming that's the CMS website relative to the No Surprises Act.
Health plan price transparency resource, 500 item services.
It's all part of the No Surprises Act.
No
yes.
surprise.
But that is probably and not to throw my carrier friends under the bus, but that might be for the carriers. The hospitals have to post, as my testimony indicated, the No Surprises Act is phased in, and so I think that might be relative to the carriers.
All right.
Okay.
That could be wrong.
The
but yeah.
hospitals, we had to do this starting in 21, and they have been posting
And which
the,
act was that that required you
the
guys?
same act. It's
Okay.
just, it was phased in because it's so complex. And that is where they have to, as my testimony indicated, that they are required to make available on their websites single machine readable digital file containing standard charges up to 300 of their common services. So that was put into effect a couple years ago. And I just think it's important to comment. Everything in this bill is already in federal law. So the difference is has to do with the collection piece, which is what I think a lot of people have concerns about, what the unintended consequences of that is.
Right.
And that is certainly something that we're opposed to this entire bill, but that is another unintended consequence. Another thing that I think is important is websites are developed now. You don't need this law in the state of New Hampshire to have entrepreneurs develop databases based on the No Surprises Act, based on the CHIS database. We had that now. I'm trying to remember the individual. I'm looking at my colleagues back there. There might be someone that was developing, I forget the name, but he has a company that it was actually, remember he was dressed as an owl.
Oh, I remember that guy.
Yeah.
Yeah, no, that was quite a guy.
That goes way back. That's
that was,
the
remember good 5 or 6 years ago.
Yeah, it was a while ago. Oh, thank you. Mark Galvin has a company.
yes,
Yeah, no, that was
yes.
thanks to Heidi. She
Yes, right,
she
right.
remembered
Yeah,
his
that-
name. Mark Galvin has a company that is doing just this. And I believe he is using some of the data now available through the No Surprises Act to develop his website even more. And I am forgetting what the company name is. It's just
It was a
can't-
hoot.
It was there was something about an owl that
It was an owl.
hence
It was
why
an
they were
owl.
dressed up as
Yeah.
owls. Yes, it was. Anyway, so I just wanted to make those points. You don't need this law to develop websites, and the piece that is different in this bill has to do with the collection piece, which I believe has a lot of unintended consequences. And furthermore, we don't have an issue in this state, so why would we don't support passing a law in New Hampshire when it's not needed?
It seems to me, I remember she said that last thing. She said that before, and I asked, which was, one is the sponsors think there is a problem. I mean, like half the hospitals are not in full compliance with the law, and so
Because they
then-
had a different,
They-
it had a
yeah.
spreadsheet.
Yeah.
and so
I think my testimony disputed that.
no,
and
it did, definitely did, yeah. And
because the federal government, HHS, who oversees those the compliance, has indicated otherwise. So that unfortunately there was misinformation, and because this company that they were referencing, I don't have the letter in front of me, but when we sent, the patientrightsadvocate.org. And when we sent a letter to the Attorney General's office, that was also part of my testimony. I think that clarified.
okay.
So, Mr. Chairman, it sounds like the information that is being sought by this bill is already being required under federal statute. Is just not being presented in the same way or the same format or whatever as envisioned by the sponsors of this bill. So we really don't have a lack of information. We do have the information. It's there. And to the entrepreneur issue, apparently, we don't need a law in order to make the market work. It sounds like even though Colorado may be a little further along with respect to startups in the technology, that it's already starting to happen here in New Hampshire. So the major concerns that are being addressed by this bill, or thought to be addressed by this bill, have already been addressed. So we don't need to pass something if the objectives sought in this bill are already being fulfilled. Thank you.
You,
I'm not a voting member, so
I know,
I
but
give up my thoughts.
you're gonna get to vote on it
Well,
next week, so when
Right.
we vote as a committee.
Yeah, I mean, I guess I would like to know if they are in compliance. I know she's saying there are. I would like, and then when I spoke to the Representative Phillips, I think was her name. I mean, she said that they weren't, and so there seemed to be a discrepancy. And I'd like to know how we know that for sure. And I mean, I remember the testimony, but yeah, I mean, I guess what is the mechanism right now if they're not in compliance with the federal law? Who's in charge of enforcing that? Is that how, like, what's the penalty?
Federal HHS. The hospitals have to follow
And so
federal.
what happens when they don't?
So
There are major penalties. But I'm happy to, I mean, if you want, I mean, every single, yes.
So the
Representative
question
Terry.
here is, I'm hearing he said, she said,
Yeah.
which do I know is true?
Yeah.
Can you provide for Representative Sullivan and the rest of us who may be interested, the documentation to definitively defend your position such that the claim being made by the sponsors is shown to be deficient?
Yes, I was going to say if
And then that
you,
settles he said, she said.
right, we can go on every hospital's website and give you the URL that shows that they are in fact doing what the No Surprises Act law requires them to do. Would that help?
Yes.
Because that settles the dispute.
So
yes.
am I looking at the right thing? This spreadsheet here, there was the third semi-annual hospital price transparency report for New Hampshire compliance.
Is that the chart that I handed out? I don't know what that is, John.
I
I'm
don't
sorry.
think you handed out because more than half the hospitals are non-compliant.
No, that's the one that they
That's from the
pointed
That's
out.
the one he
sponsors.
handed out.
Oh, okay. Yeah, I did
And
not
then-
get
and
his
what
testimony.
And then their explanation of why my hospital is standard charges file fails to provide an adequate amount of negotiated minimum, negotiated maximum, or negotiated rates. That was what, that
I think
was,
there was like-
that was the
Isn't
disqualification.
there like 8 different metrics in which you have to be
there's-
compliant
yeah,
with?
and there's a lot of no's.
And most of them are not compliant with all 8 or whatever the number is.
Was there
I-
actually
it was,
anybody?
remember, it
So
was
are the
the,
metrics-
actually got yes.
the
Are the
different-
metrics different from the
Yes.
federal
Yes.
to the state?
yes.
So you're asking the hospitals to supply metrics, one set of metrics for the federal government and one set of metrics for the state government, and we get a report that that there are certain hospitals that are not apparently supplying all of the data for the metrics that are required, whereas what you're saying is that with respect to the federal metrics, the data is being completely
Right.
supplied,
Right.
and therefore the legislation is being satisfied with respect to compliance here in New Hampshire.
Right. So there was a chart that I handed out with my testimony. Not mine was color coded. That is from my testimony. Was that my testimony? Yeah. And there's a chart. No, there was a letter and a chart.
Okay, so do you have a copy of this? Do you know?
No, I
Okay.
don't.
So this is from patientrightsadvocate.org.
Yeah, unfortunately, that's attached to my testimony, but that is not the chart. I will send you, I don't know what happened.
So
There is a
would-
colored chart. Do you mind if I just look at that real quick?
So the one thing I could say is these were last May and June. So it'd be nice to see what their latest screening is.
So this with the yes and no's, that is our analysis of the patient advocate. Again, what they were using in their report, in their audit, versus what CMS requires, which the hospitals have to follow because they are all have to be compliant with the federal government because they are CMS. CMS over,
So they'll lose some of their CS.
They can't be Medicare or Medicaid
They would lose
providers.
being able to be providers.
So what we did is compare, and then we can show where the requirements match, and most of them do not. So that's what this is. But I think there was another chart that the other group might have handed out that I have not seen.
So how about we just retain this and keep on? I would have to say, on the face of it, my problem is I am very reluctant to be the enforcer of federal laws and passing state laws to enforce federal laws.
That's fair.
And so that's where my reluctance to get into this bill. But and
Well,
then
you're also imposing a second set of requirements. According to patients' rights advocacy,
Right.
they have these different metrics. So now we're saying to the hospitals, well, now you got to supply the responses on the basis of these metrics to CMS.
Right.
And then you got to supply, now we got this other set of metrics, and now you got to employ people to develop the responses to these
which
sets
is
of
a
metrics.
new mandate. That would
Right,
be a state mandate.
So you got double mandate.
And
you don't
what's
ha-
generating our mandate is some third party organization that,
So my question is, what's unsatisfactory about the federal
Well,
requirements?
I think that's actually not what the law is trying to do, because it says that they're trying to make sure they're in compliant with federal laws.
That's what
So-
I thought the bill
Yeah,
was
that's
about.
how I read the law.
I read the bill
And
was
they
that
were
it had to
arguing
be
they weren't.
yeah.
The hospital administration's arguing that they are. But I think that they're not trying to create a second mandate from the
But
state.
they insisted that the website be up to date, like almost momentarily. When she was talking, when the
Right.
representative was talking, they expected it to be updated
Dynamic.
very quickly
Dynamic.
and also much more accurately than we could ever hope to do. So it is a set of other regulations on top of the federal regulations
it's
in
a new-
effect.
it's a new
and
mandate.
It may not be doable.
Is that in here? I don't see that anywhere in here.
No, she just saying that that's what
But
she
that
was
was the
doing.
I think she was saying that
That's
it
what
would
the
work.
testimony said.
Because frankly, if we were to pass this, I would want us to specifically state which web page is the one to be used. I wouldn't say if you can come in with any old third party and say they've got evidence differently. You would actually, if you're going to try to enforce it, or at least hold up in court, if not that they would go there, but have legitimacy, it's got to be from a recognize. We got to in our statute, we got to recognize the actual entity in which is being the
I agree with that.
the
Yeah.
And would hospitals
adjudicator.
even want to start entering data in yet a second database?
Didn't we just hear
I don't
clear,
think- I don't
loud
think
and
that's what
clear
they're
is that this you're never going to get a good number.
No.
You're never going to get.
Well,
And you're never going to get them to agree.
This is feel good law legislation, frankly. That's right. Senator Hassan was the sponsor, wasn't she?
And why do we need to require the state to do something where there is an asserted failure at the federal level when it's not been demonstrated that there is in fact non-compliance with the federal regulations? I mean, do we really have something here that's going to improve on the federal regulations? I did not hear that from the sponsors.
Okay.
I didn't
Pacelli
hear
and then
that. I
Walsh.
just-
So help me understand the compliance. So who is reviewing? What is the compliance process? How are the New Hampshire hospitals notified that they're either in or out of compliance? And then what are the existing penalties?
So the No Surprises Act is very extensive, and there are requirements that the federal government is the one that the entity that will be auditing the hospitals and have done this periodically with all our many of the hospitals throughout the country. I think the biggest issue is what was being touted as saying the hospitals are not in compliance was using this other entity that did this study, did not follow the federal government. The hospitals have to follow the federal law. So this other entity, this independent patient advocate did a different study, and that's what the sponsor was using to say that the hospitals are not in compliance. My contention is they are in compliance because we have already checked, and the federal government has not cited them for not being in compliance. So the other problem is if you're not in material compliance, then that's the new part of and I agree with Representative Spear that there are two standards, because then if they're not in compliance, according to who, then the patient will not be responsible. So you're then creating this other issue of collections or not being able to collect. So it just added another layer. That's the piece that's the difference. Then it's still the federal No Surprises Act. But again, our contention is it is not necessary because they are in compliance with, they're not, I mean, hospitals are not going to be required to follow
criteria,
the
it
patient
was-
advocate.
And the criteria sounds like it
They're
was
different. Like as my chart shows, the criteria are different. So of course the results are going to be different. So
Representative Walsh.
Just a question, why would you retain versus ITL?
Yeah, Mr. Chairman, absent rebuttal.
Okay.
Mr. Chairman, absent rebuttal from the sponsor or one of the co-sponsors, and neither one of them are here today, I don't know how we retain something that has been demonstrably shown as being unnecessary
Okay.
or inexpedient at this time.
Okay.
No, I'm already the chairman of a commission. I'm not moving this.
He's scared. Okay. So someone else, a member of this, okay, Representative Calabro. Seconded by Representative Post. Moves ITL. Any discussion on the motion? Seeing none, the clerk will call, oh no, all those in favor say aye. 1, 2, 3, 4, 5, 6. And who am
Where's
I
the
missing?
seventh?
Who's the
Out
seventh?
of the room?
Did you vote it, right?
I voted.
Okay, 7-0.
7-0.
7-0. Okay.
Okay, one to go.
Last to go.
Here we go.
Relative to health insurance coverage for preventable PFAS care. This is a health insurance mandate. Well, if I understand this building, is the sponsor here? Oh, there she is. My understanding of the bill is that if someone wants a procedure and says the reason he or she wants it is because they have high PFAS numbers, then they have to do the procedure. We're mandating the procedure has to go forward.
Not quite.
Okay.
So it all, what triggers the not the procedures, but the follow-up and the monitoring and the oversight of these people is if you have a blood test and it's above that 20-point limit. So that's what triggers all of this care, that 300 pages of care. So it could start, with an infant, so you don't wait for symptoms. You get the blood test and that's what triggers it.
So, but what is the procedure that you're then requiring?
It's all outlined in those 300 pages. So for an infant, you would have screenings for disabilities. You'd have screenings for autism. You would, starting, I think they say at age 1 that you start testing for cholesterol and high blood sugar. So, and these are things that a 1-year-old is not going to be able to tell you. I've got.
No, I'm not worried about
cholesterol.
that part. What I'm worried about is when we talk about mandates in this committee, and I guess just give a historic perspective. Many years ago, Dartmouth Hitchcock wanted to try for breast cancer, for solid breast cancers. They wanted to try to do chemotherapy to this, and they basically put this committee as playing doctor. Right, we had to determine whether this was appropriate care. We're bypassing the medical directors of the insurance companies, and we were going to unilaterally make this decision.
Right.
We passed it. It turns out that they only did it for a year and then realized it didn't work. Okay, so now I'm as carrier of that history. Okay, is I'm emphasizing is that what we want to deal with is we have situations where if that let's take the breast we found out that some insurance companies were waiting for a year and a day. In other words, in terms of we were saying they were doing breast tests every 2 years rather than doing it annually.
Yeah.
So then we were now the legislation was for us to mandate that, yes, it can be done manually. All right. So, what we're dealing with in any legislation when it comes to these health procedures is that we're dealing with an insurance company won't do a procedure which that your physician or that the generally accepted medical practice, okay, has said that is appropriate, these are appropriate. So that you have to, in terms of way I read this bill, it seemed very open-ended. It
No.
wasn't specific.
It's very specific to the guidelines, and those are CDC guidelines. So
Right.
that 300 page, there was some confusion up here about where that document came from. The CDC I can't think of the word, contracted with that agency to develop these guidelines, which are going to be adopted by the CDC. They were supposed to be adopted in December, but there's been a change of director. So eventually these guidelines are going to be adopted. They're in use in a pediatric center right now, and they're referenced by PFAS, the Silent Springs, Silent Springs organization on the Cape, which is, they do a lot of PFAS research.
Okay. So, and then, so if you're tested and you have these things, what are we mandating? What procedure, what are we mandating at that point?
All of them. All of them.
What is all? That all is not a good word. What is specific? Okay, Representative Calabro thinks he's an expert on this issue, so let's hear it.
Not an expert. I just read the 300 pages.
Brilliant.
That
Thank
makes you
you.
an expert.
Well, I felt it was imperative seeing that I am a PCP.
Oh.
So this is pertinent to me.
Thank you.
I was very ill about halfway through it, reading these protocols, being aware of what is coming down the pipeline. I was concerned as a PCP who's being inundated fighting insurance companies every day. Something like this is going to impact me pretty badly. Trying to order anything, Medicare, Medicaid, that is not completely covered already is a huge battle. We're already understaffed. Profits are bad. So make this make sense for me. How are we going to?
This is a start. This is a start. So I'm in touch with our federal delegation to try to get this passed also on a national level.
Right. And further inquiry.
Further question, inquiry.
Once it is adopted federally, and we know there's delays and when that's going to happen, I agree with you. This is how I'm going to practice medicine going forward to cover my butt.
Thank you.
Okay.
Yeah.
But the reality is, insurance companies may not be quite so forthright to support those protocols.
Which is why we need to mandate them.
Okay.
Because these protocols are not silly protocols, if you've read the document. I mean, they're very specific.
It's real.
Start with birth, essentially. Actually, it starts with pre-birth because the mother has to be tested, and goes. So it's cradle to casket. Birth to death. All of these, and so it's as you get older. You don't get the same tests every single year. You get modified tests based on the criteria that was established. And if you look at the first page of that document, I mean, there's many organizations that have contributed to this. This is not.
No, it's a cumulative meta-analysis, I think, from everything throughout the country, basically, to try and bring forth something that the CDC will say, yes, this is fine.
Right.
And I get that.
And
It's
so,
legitimate.
and if you recall, the reason that this came about is that I had an operation that was initially denied, and I had I heard of a young woman in our town who has breast issues,
29.
and she was told she was too young. So that's the reason, is that we have a PFAS problem in New Hampshire. We have it. It's here. We're suffering, and so this is a way to protect and to institute. So just because the CDC is going to adopt these guidelines doesn't necessarily mean that all of the states are going to adopt them, or that insurance companies are going to adopt them. We're going to uncover a lot of problems earlier, which is good for people, but it's not good for insurance companies.
Right. And you realize this only affects a third of the state's population.
I do, which is why I'm in touch with the federal delegation to see if we can maybe do something for Medicaid and
Federally,
Medicare.
right.
Mr. Chairman?
Yes, Representative Bros.
Before I ask my question, you said it only impacts 1/3. You mean because it's in the southern part of the state?
No,
No.
because under our statutes, that other entities are exempt. So if you're Medicare, Medicaid, or an employer, large employer, which is known as ERISA,
Yep.
our legislation can't affect them.
Okay. All right.
So this only is for small employers,
All right.
and the individual market, because I can't seem to find my
I would
copy of the
say
bill.
1/3 is a good start.
That's-
And, you know, and if,
Is this the bill?
I mean, if somebody, back to your discussion about, breast cancer, if a doctor or you find a mass, you don't say, well, you can't have a mammogram because it's recommended in year 2. You're going to go see what's about. You're going to do a mammogram and see what treatment is. And again, if blood tests are showing that there's a problem here, we got to pay for it to see what's going on.
Right.
Particularly given what we're seeing in terms of illness for people.
Just to use that breast cancer example, you may not know that you have breast cancer for years and years until you feel a mass or something like that. So these young women, and I'm talking early 20s, that are starting to be positive with cancer, they might not even know that they have. I mean, we need preventive care, for these young women who have been horribly exposed to PFAS. I mean, the damage is done.
Yeah.
It's in their body. Now we need to take care of them.
I totally agree with you.
Yeah, thank you.
What is the definition? What is the definition of preventative PFAS care?
Well, it's essentially following the guidelines that are identified in that 300-page. Right, and you have to. And the insurance fellow that was here, Alex, I don't remember. I didn't
Yes,
get his
Alex
last name.
Feldwebel.
Yeah, and he was quoting from a chart, and he was saying he couldn't understand what the problem was because the guidelines are already established. That's a chart from that document, that 300-page document.
Right. So therefore, it is covered.
Mr. Chairman,
It is not
May I
covered.
ask for
Why is it not
clarification?
covered?
Because it hasn't been fully adopted yet.
CDC's.
No.
May I ask for a clarification?
Yes, Representative Gibbs.
Thank you. Yes, the CDC guidelines referenced in the bill, that is that 300-page document, which was developed by an organization under a contract with the CDC, but has not yet been adopted by the CDC, but the CDC plans to adopt it. Is that correct?
It was supposed to be adopted within 6 months after publication. However, and that would have been December of last year. But there's been a directorship change at the CDC, and so they've put it
So
on
do
hold
we
for
know
now.
when it is going to be adopted?
We don't know right now, but there is no. So the holdup has nothing to do with the content of the publication.
I wasn't asking about that. I
Yeah,
was just asking
yeah.
about the
It has to
procedure.
do with politics within, not politics, that's the wrong word, but employee shuffling. That's probably better.
But it is your understanding and that of other stakeholders that this is going to be adopted in short order, and those are the guidelines that are
Correct.
specified in the bill.
Correct.
Thank you.
Correct.
Right. So what I'm trying to get at is that what is the preventative? What is procedure, what process, what medication, what is being given that is not being given by insurance companies now?
That's a very broad-based answer, but if you were to talk, if you walked into my office, I'm going to do a blood level. I'm going to start from there.
Right.
Okay.
You got
I'm
a
gonna
big
get
high level
series
or
of your
something.
yeah, I've got to get your history. I've
Yeah.
got to get all of your history, and I need to assess your risks according to these protocols.
Great.
Okay. So when I see certain things, say I get a red flag, I get a feeling in my gut something's not quite right, I may need to order imaging. I may need to order things to do further evaluation to look for those risks. Okay. In a woman, this is a little bit easier because of the way it plays in with hormones and how much more prevalent it is, I feel, going to be for women. This is a little bit more of an easy discussion as far as that's concerned. But there are protocols. These are the things that I have to follow, okay? These things will be adopted by the CDC. The AMA will approve all of those things. So nothing that's in that document, that 300-page document, is under scrutiny or question, okay? It's just a timing thing here.
But again, if we're going to be mandating something,
Yes.
what are we actually mandating? Are we mandating that you should be able to order a scan?
Yes.
Or,
Yes,
so right
and
now,
get
when you
coverage.
order, when you say is a scan, you have to put a diagnosis in, right?
I would have to, and
Normally
I
you
would
have to
say
put
an
a
elevated
diagnosis.
I would have to find out what codes would be eligible first
Right.
before I play that game.
Yeah.
And then, and that way I don't end up having to.
Well, that's what I'm
fight
saying. If you can
that.
already do that now, then I
But
don't
they're
understand
not,
what
won't be
we're
covered
legislating.
because it's not covered yet.
It's not covered.
So you're saying that right now there is no code.
No, the
There
codes
is no,
exist.
we're going to be mandating the creation of a code.
The codes exist.
Okay, so there is a code.
Yes, sir.
So the code is that this person has elevated
PFAS.
PFAS.
Mhm.
So and you are concerned that this person might have a tumor growing in them. So therefore, you can't. If you ordered up this scan,
I'm going to order
they
additional.
wouldn't give it. The insurance company would refuse it.
That's correct. That's correct. So if I have
Okay.
a patient
You
who's
know what I
under
want to
30
do?
years.
What I want to do is I think I've just got that question out.
Yeah.
We have insurance department. We have insurance companies. We have. I see 3, 4 here. Okay, you know they're all represented here. So that's your charge, to tell us are you declining now these things? So we need this information. Otherwise, otherwise I think we would just otherwise let's retain the bill. So I mean, we can do another hearing, do this again next week.
You gonna bring them up? You gonna ask them 1, 2, 3, 4?
Yeah, and they'll come up and they'll see whether they're going to cover these things. All right. So we'll adjourn this subcommittee unless Representative Post, you have something new.
Excuse me, thank you, Mr. Chairman. I wanted to ask a question because when I was in RR&D and we were dealing with PFAS, there are so many different variations of it that they were taking little chunks of it at a time to, put them on the books. So, I mean, I know we say PFAS, but that is a huge umbrella. So I can't imagine there's a code for every single one of those right now.
No, and that 20 point, I think it's nanograms in the blood, that's total. So that covers all of the ones, not just.
Okay.
Right.
I didn't realize that.
So the other thing is that this, I mean, we've been talking about women. If a man walks in and he's, of adult age and is showing high PFAS, you would typically not start screening him for prostate cancer until he's much older. But with this, he starts getting screened earlier. If you're an adult, even if you're a child and you have high PFAS, they have to start scanning not scanning, I don't mean, imaging, but they have to start looking out for kidney cancer because that's going to pop up, well, it could pop up eventually. Yeah. Okay. Yeah. So this is to put in place screening based on that blood work, and it's to avoid patients like me having to spend hours on the phone trying to justify a surgery with an insurance company because, it wasn't in the books or it wasn't recognized. No. Well, it was through my husband's. He works for Red Hat, so that's a fairly large business. Yeah, I'd have to look that up. Yeah, but I'm working on it in Washington. Sure. I would be very interested. Yeah. What? I would challenge if they say it's all covered, but you can hear what they say. Yep. Yeah.
Everybody looks at things without a bill. That then means nothing. That means that the bill was sent to some agency to see if there was a financial consequence. That's all an FN means. Now, so if you wanted to know what bill is going to go to a second committee, okay, which is why we have it early. I have found that if you look on the web page and you click on just the right docket button, and it's under the one that's under the committee to make an effort, it's under the one at the actual bill, in there, you'll see there's a spot where it'll tell you if it has to be due out February 16th versus March. Okay, and only I have that on my desk because I get yelled at if I don't put the bill up. Which said that the last thing you can see on there is a dash A. Dash A means there's an actual appropriation in it. And that means you guarantee that's an early bill and it has to go to finance.
I'm looking at the fiscal note on this one, and it's all zero and indeterminable.
So we'll take it up next. Well, I actually, now that I think about it, because it's not an early bill, I might push this off till later for us to work on it. Okay. Yeah, I don't, we're in, the subcommittee's over.
Maybe he'll push it till when?
Oh, yeah, we gotta push it out. Yeah, 1:30. Yeah, right now we're supposed to be 1:15, right? Yeah, 1:30. Okay. Okay.
I'm going downstairs, John.
Okay.
It's a little too much to go to Tandy's for half.
Yeah, this, yeah.
Okay.
phone.
We're doing. Sorry for the delay, everyone. Call the hearing to House Bill 242 to order, and we'll hear from the prime sponsor, Representative Dunn. And okay. The prime sponsor's not here.
Murphy, Brown, Hillsborough, Wendy Thomas.
Is she?
Anybody here?
Representative Thomas, would you like to introduce this bill since you're a co-sponsor? All right, we'll get things moving. Just pull that mic close to your mouth and make sure the red light is on. Thank you.
Good afternoon, members of the committee. It's good to be back. Actually, I didn't leave, but I am Representative. Oh, we're introducing.
Sorry, I apologize. All right, if you want to double team it or however
well,
you'd like.
I do have something to say.
Yeah.
So eventually.
All right.
Yeah. Okay. Go ahead. You introduce.
First, I apologize. I'm across the hall in executive session, so I'm trying to double duty, so I apologize. Good afternoon, committee chair. My name is Representative Dunn, Londonderry, and I'm here today to speak to this bill. Thank you for allowing me to speak to it. PFAS is a group of chemicals that are tasteless, have no smell, are invisible, making them virtually unknown to the average person. PFAS chemicals are listed as a forever chemical, meaning they never go away. PFAS is a chemical that, according to the Agency for Toxic Substances and Disease Registry, they can cause immune problems, kidney cancer, testicular cancer, high cholesterol, thyroid disease. And this is only a small sample of the problems caused by PFAS. PFAS is a chemical that you don't want to ingest in any quantity. No amount of PFAS is acceptable. PFAS affects not only humans, but pets, wildlife, fish, to name a few. Fast food retailers such as Chick-fil-A, Wendy's, Chipotle have removed PFAS already from their packaging. McDonald's, Burger King, Popeyes have all committed to remove the PFAS from their food packaging by 2025. Grocery chains such as Trader Joe's, Whole Foods are currently using PFAS-free food packaging. There should be no tax money spent on this bill. In states that have already passed the ban on PFAS in food packaging, they put the onus on the manufacturer. In order to sell food packaging in these states, the manufacturer must provide a certificate of compliance in order to sell their product in that state. The intent of this bill is to prevent further exposure to PFAS from food packaging. By reducing PFAS in food packaging, we hope to reduce the health costs associated with what this forever chemical causes to people's health. This bill will also remove PFAS from food packaging in the waste cycle. This will thus reduce the amount of PFAS going to landfills, thus reducing the amount of PFAS that can leach into the groundwater and, when it is burned, released into the air. This bill will also not raise any costs on small business. A study was done by the Department of Ecology in the state of Washington. They have identified that there are less hazardous alternatives that are already available in the market that will cause no financial impact to any small business or to the average consumer. In conclusion, Mr. Chair and committee members, PFAS is a forever chemical that never goes away. We need to limit our exposure to this forever chemical and remove it from all food packaging. No amount of this chemical is safe. The intent of this bill is to put the onus on the manufacturer and not the taxpayer. This bill is one way we can help keep our citizens and children safe from this forever chemical called PFAS. Thank you, Mr. Chair and committee, for your time today. I'm happy to take any questions. If there's anything related to health and science, there's much smarter people than me sitting behind me that can answer those questions. Thank you for your time. Oh, sitting next to me. Yes.
Thank you. And in the interest of time, Representative Thomas, would you like to testify? And then if you don't mind both taking questions together, that
Sure,
that would
sure,
be...
absolutely. I'm Representative Thomas. I represent the town of Merrimack. PFAS chemical, oh, and thank you for letting me testify in front of you. PFAS chemicals are often called forever chemicals because they do not break down in the environment. PFAS are used in food packaging to prevent grease and water from soaking through food wrappers and beverage cups. PFAS can also be found in the ink used to print logos and instructions on food containers. This raises alarms about the use of these compounds, especially in items such as burger wrappers and salad bowls. These substances directly migrate into the food you eat, especially when that food is hot. It's especially likely when food is fatty, salty, or acidic, like pizza. Some research even suggests that PFAS levels are higher in people who regularly eat out. Identifying the exact type of PFAS in a product is complex. There are more than 9,000 known PFAS chemicals, yet common testing methods can identify only a couple dozen. Consumer Report tested products for their total organic fluorine content, which is considered the simplest way to assess a material's total PFAS content. That's because all PFAS contain organic fluorine, and there are few other sources of that compound. California had banned intentionally adding PFAS starting in January 2023. Paper food packaging must have less than 100 parts per million organic fluorine. Denmark has settled on a 20 parts per million as their threshold, and the Consumer Reports experts support the 20 ppm limit. Denmark, Maine, New York, Washington, and Vermont have already banned PFAS from food packaging, while Minnesota, New York, and Connecticut have purchasing policies bearing packaging with the chemicals. California, Minnesota, and Maryland are considering phase-out laws and/or developing regulations. If you go to the CDC website for PFAS advice, one of the first things they state is to, quote, stop the source. That's easy when you have known products like Glide dental floss or Shoe water repellent, but it's not easy to do if the chemicals are hidden by businesses in their containers. One objection to this is cost to businesses. They would need to switch to non-PFAS food storage containers, but many companies are already doing that. McDonald's, Wendy's, and Whole Food Market are among the at least 15 companies that have announced policies in recent years to phase PFAS out of packaging that they use or sell. Let's also talk about the reaction of the consumer. Recently, Simply Tropical Juice was recalled because it contained too much PFAS. In a class action suit, the plaintiff's third-party testing showed that the presence of multiple PFAS in the Simply Tropical Juice included more than 100 times the EPA recommended levels of PFOA and PFOS. I can tell you now that as a consumer, a mother, and a clean water advocate, Simply Tropical Juice has lost my trust. I expect a product to be safe when I purchase it. And when it is not, when it contains chemicals that can make me sick, then that product has lost my respect and my business forever. Thank you.
All right, questions from the committee? I think I saw Representative Spears' hand first.
I was going to ask the question, and you may have answered it. What kind of packaging is high in PFAS?
So anything that repels grease. So the biggest ones are burger wrappers, pizza boxes, and a Chipotle restaurant had PFAS coated bowls because they have hot rice that they put into those things, the bowls. So.
And Representative Filio? Filio. Oh, so close.
How do you intend for this bill to be enforced? I see that on the second page, we have municipalities shall be the sole authority. But what would happen if a municipality decided to set the fine at 0?
If I could ask DES to speak to New Hampshire, because they have a plan for that.
Oh, okay.
Is it possible?
So
So-
apparently DES will be up,
Done.
and they'll cover that.
So we'll hold the question for the next testimony. Representative Porcelli?
Thank you. How are the, let's see, the containers or the service products, are they labeled? How would a food service business know not to use a particular supplier because they're high in PFAS food packaging? Is there
We'd require a
label?
certificate of compliance.
I'm sorry?
We would require a certificate of compliance.
Certificate of compliance.
Couldn't hear that.
For the packaging.
Yeah.
Right. So is there something on the package that says no PFAS chemicals were used in this package? I mean, how would I know when I'm buying bowls not to buy them?
I think it's similar to the BPA. You know, a couple of years ago, we banned BPA and we couldn't use it was in baby bottles and all that kind of stuff. And so now industries and businesses don't use BPA, and they actually say, you know, no BPA in this product. So it would be similar to that whole process.
Follow up. Has that already been implemented so I know not to buy these particular products?
The PFAS ones?
Yes.
No, it has not. That's the problem. Is we don't know. We're getting food containers from these businesses that are coated in PFAS, and we are not aware of it. That's the whole reason for this bill.
So is there going to be some type of notification?
Well, it would be compliance, but it's his bill. I'll
Yeah.
let him.
It would be compliance. And to answer the past question, I just pulled it up. What we were trying to do is with this bill, I had put an amendment forward. I believe this committee likes to do their amendments in subcommittee. So what the amendment would hopefully put forward is that the Northeast Waste Management Officials Association would be the group of people that would get the certificate of compliance.
Okay. I'm sorry. We'll go Representative Burrows and then Representative Walsh.
Just before I ask my question, I think we would like to see your amendment. The committee would like to see it.
The amendment's out there. I don't believe that the chair, when I spoke to the chair, he said that you guys do all your amendments in-house. The amendment is
not
already
true.
there. It's in the end.
You can email it to the committee email address.
Okay, all right.
And that would be good.
Absolutely, I'll do that.
Okay, but here's my question is that since that you need certification, the concern that was placed in the fiscal note that municipalities would have to test
Right.
is not a concern.
So the amendment takes care of the fiscal
Yeah,
note, hopefully.
okay, thank you.
Representative Walsh.
In order for this to be truly effective, don't you need it to be done at a federal level? Because otherwise, why would companies say any of the, list what's in, the ingredients or?
PFAS, yeah.
Yeah.
Absolutely. And again, I'm working with our federal delegation to try to get that passed as well. I mean, these are bills that we're proposing for New Hampshire because we have a significant PFAS problem in New Hampshire. They should be proposed for the nation, because by the time you find PFAS in your water, it's too late. And PFAS has now become a national issue. So yes, it should be but until it becomes a national law, we've got to protect our residents in New Hampshire now.
All right, any further questions? Seeing none, thank you both for your testimony.
Thank you.
Yeah, do you want? Yeah, you want to give it to, I'm the clerk, so if you want to, I'll put it in the folder.
Just pass it up on the end there. Yeah. That's, yeah. All right, next we're going to call Jody Grimbliss from American Chemistry Council, and she asks for 2 minutes.
Thank you. For the record, my name is Jody Grimbliss, and I'm here representing the American Chemistry Council. We have concerns about the bill as presented. I understand there may be an amendment, so we'd obviously like, sorry. So we'd like to get an opportunity to take a look at that amendment. The American Chemistry Council is the national trade association of chemical and plastic manufacturers, including some of our member companies here in New Hampshire. Over 96% of manufactured goods are impacted by the business of chemistry, so it's kind of an essential part of our nation's economy. The chemical industry supports a comprehensive approach to managing PFAS, and that would help to ensure protection of human health and environment. That includes appropriate science-based policies and regulations. So one of the things I would note about the bill is that what I understand is that there's significant levels of study, science, and regulation being done at the FDA. So I did bring information for the committee about from the FDA's website about questions and answers on PFAS in food, and also also authorize uses of PFAS in food contact applications, food packaging. So again, it's being looked at the national level. I think there was a question about should this be a national policy. We would agree it would, because patchwork regulations from different states is often hard for the whole supply food chain. But I would leave this information. I'll pass it out as I finish, that you can look at. And I will tell you that I did double check the authorized uses of PFAS in food contact. There are PFAS, I think as Representative Post mentioned in one of the other committee hearings, PFAS is a wide variety of chemicals with different chemical infrastructures, different substances. They're not all the same. So there are some that have been studied by the FDA that are okay and safe for food contact, and there are some that are not. Obviously, some of the PFOS and PFOAs are not. So this document explains some of that, and so I will leave it with the committee, be available for subcommittee, and I hopefully be able to bring somebody from the Chemistry Council to be actually able to answer the more scientific questions. But I'll leave it at that.
Okay, thank you. Questions? Representative Bellew?
Yes, thank you. Chair, thank you for taking my question. You represent the chemical company? Chemical industry?
Yes, the American Chemistry
So is that a
Council.
conflict of interest? Testifying on this PFAS?
No.
Because they manufacture it?
No, that's the job of a lobbyist. Yeah, that's what a lobbyist does, is represents their,
Right.
their client interests.
Right,
No,
but I tend to not believe her testimony because of where it's coming from. But that's
We
my
won't
own
insult the
personal-
witnesses. And, thank you. Not appropriate. Sorry. Representative Bros?
Yes, this is a would you believe.
Sure.
And so would you believe, hypothetically, we had a botulism in some of the food supply that comes into New Hampshire. I don't think we would wait to see what the federal government was doing to address it. And I think that this is a really serious health problem. And I don't think that we should be waiting to see what the federal government does before we address it here, because we have people getting sick and dying in the state.
I understand. I just want to bring forward what they're doing.
Thank
so
you
that
so
way
much.
You
I
know.
appreciate
It may
that.
not be
All right,
soon
thank
enough.
you. Representative Spear, and then we'll go Representative McAleer.
Thank you. In line with Representative Burrows was saying, we have communities here, and my sister lives in one of them, and we're soon to be living in one, they are literally not allowed to drink the water, and they get water delivered to their house from the company that's been polluting all these years. And I agree, we cannot wait for the federal government. And it seems like the chemical industry is being just a little bit cavalier about the whole thing.
Do you have
What
a
are they
question?
doing specifically? Are they doing anything? Are they just sitting there waiting?
No, I don't think so. I can't speak for all of the, and again, I think I will bring somebody for the subcommittee from the Chemistry Council so they can speak to all of the things that they're doing. I know 3M is not a member of the association, but I know they have, I think recently announced that they're getting rid of all the PFAS that they have used in the past. So I think there's a true recognition that PFAS and PFOA and PFOS are problems. I believe so, but I would prefer to have somebody from the council speak to you directly. But I will definitely put that in my notes to get back to them to do.
Representative McAleer.
Thank you. You mentioned right from the beginning that you had objections as to the way that this is written. And again, then you referred to maybe it should be a federal law, but what specific problems would the chemical industry have with this bill?
So there were a couple of questions that they raised. So for example, there's some language that's pretty broad, and they were trying to understand typically when they face these kinds of, when there are these policies passed in various states, they're very, very specific. So for example, a service product on line 16 talks about means a food container, bowl, plate, tray, carton, hot and cold beverage lid, or other item. They're like, what does other item mean? And so I think it's just the specificity that would be, if the committee decides to move forward with legislation, to look at some of that language and be very clear about what you mean. It's helpful for all of the levels of the supply chain to the consumer.
Representative Terry.
So with respect to your knowledge of the laws that have been passed by other states, would you say in general there is a greater level of specificity such that you do
Yeah, and
not have
I'll
those
ask-
same kinds of concerns that you do with this bill that apparently has not been modeled as
I've
as
asked for
carefully
them
on
to
the
send
other
me, and I
bills?
think Representative Thomas mentioned Vermont has passed something, New York has passed something, so I'm trying to see if I can get those laws to see how different they are.
Okay, thank you.
Sure.
Representative Walsh.
Thank you. Would you believe, I do have a question, but I was a plastics buyer for Hewlett Packard at one time. Is your data that you're going to pass out, am I correct in hearing what you said, that there are some forms of PFAS that do not leach into,
Yes.
humans, as far as they're used for various packaging materials and they do not leach? Because having been a plastics buyer, there's lots, that's like saying all plastics is bad. It's not. I think that you're going to provide us with some data that shows that there
Correct.
are different levels.
Correct.
Acknowledging we do have a problem in New Hampshire, but there are
Okay, we just
apparently
have to keep it to
exceptions. Thank you.
questions for the hearing.
Correct. I'll just say on this, which I will pass out, the fourth bullet is paper/paperboard food packaging. PFAS may be used as grease-proofing agents in fast food wrappers, microwave popcorn bags, takeout paperboard containers, and pet food bags to prevent oil and grease from foods from leaking. But then it goes on further on to tell you which PFAS letters, numbers, etc., is actually the ones that have been proven to be safe.
All right, thank you. No further questions. Thank you for your testimony.
Thank you very much.
Next, we'll call Noah Grays from the New Hampshire Municipal Association. And he asked for 2 minutes and he has a comment.
Thank you, Mr. Chair. I know my handwriting's terrible. It's Nate Grace from the Municipal Association. I don't believe I've been in front of your committee this year, so briefly, we are a volunteer membership organization comprised of all 234 cities and towns. We provide them legal advice, education, and training, and of course, we come here and advocate. The sole issue that we had with this bill as written is page 2, lines 2 and 3, which gives municipalities the sole authority to regulate, implement, and enforce the prohibition on food service products containing PFAS. It's not that we're not concerned about the impacts of PFAS on our citizens. It just seemed inefficient to have municipalities be the ones to regulate that when it's obviously we live in a small state. It seemed more appropriate to have a statewide regulatory authority. In talking with the prime sponsor, he has drafted an amendment that I believe addresses all of our concerns. So I would urge the committee to look at that when he provides that to you. And that's all I have.
Thank you. Any questions? All right, seeing none, thank you for
Thank you.
your comment. And this is the last card I have, so if anybody else would like to speak on 242, you have to file a pink card. And this is Kevin Daigle from the New Hampshire Grocers Association. He opposes the bill and asks for up to 4 minutes.
Good afternoon, Mr. Chairman, members of the committee. For the record, my name is Kevin Daigle, and I'm with the New Hampshire Grocers Association. For those of you not familiar with us, we represent both chain and independent grocery and convenience stores. I did pass around some testimony that's coming around, so I'll try and keep my comments brief, as I know you're trying to stay on schedule. While the concern surrounding PFAS is well-founded, this bill creates some concerns, and because of that, we appear today in opposition. In applying its own requirements for packaging, New Hampshire is creating a burden on our businesses, one which puts us in the position of policing product packaging while trying to source manufacturers who are able to comply with the state's restrictions. This is something that will prove to be both challenging and costly. Additionally, as I understand it, the use of PFAS and other chemicals in all food packaging is already regulated at the federal level by the FDA. In order to demonstrate that food packaging is safe for its intended use, the FDA requires upfront submission of extensive test data and scientific information regarding chemical composition, migration levels, and toxicity. Additionally, the FDA can withdraw its approval for a food packaging chemical at any time if available data no longer demonstrate that the substance is safe for its intended use. So we feel this is an area that should be addressed on the federal level to ensure we're not dealing with a patchwork of state mandates and additional costs for compliant packaging. So for these reasons, we ask you to find House Bill 242 inexpedient to legislate. Thank you.
Thank you very much. Any questions? Representative Billiou.
Thank you, Mr. Chair. Thank you for taking my question. I'm not sure if you can answer this, but the packaging could be labeled, this packaging was made with PFAS or has PFAS in it. Is that possible?
I'm sure it could be. It's outside my area of expertise, but I'll do it something that I can relate to. So years ago, this legislature took up a bill on GMO. And it
Correct.
was to have labeling on specific products that were going to be here in the state. The problem is New Hampshire is such a small footprint. So for us to dictate to manufacturers that it would have to vary its labeling just for those items sold in our state, we had manufacturers tell us they wouldn't do that. So they would actually limit the number of items they would have been able to sell in the state based on that. Can you do it? I'm sure you can. The number of states that are involved makes it difficult because we don't have mass production of packaging here within our states. So we're transporting that in.
Just
Follow
a
up.
follow-up. If all of the packaging that was sold throughout the U.S. was labeled, I mean, that would make it
That'd be
easier
fine,
for the
right?
manufacturer.
We want a level playing
Correct.
field, right? So
Uh-huh.
so it's difficult whether it's a small member who has, a couple stores here in New
Correct.
Hampshire and a couple in another state, or a multi-state larger chain. We just want to be able to have the same dynamics across.
Yeah. Okay,
state
thank you.
border. Thank you.
All right, any other questions? Representative Spear?
We have a particularly bad problem here in New Hampshire, and I'm sure your families are here as well. And would you feel that it, as a community member facing the same health issues that we are, not able to drink our water, not able to trust even the packaging of our food, that the grocery association and the members should take some effort just to protect the communities that they live in?
Well, thank you for your question. We do take concern with those in our communities.
I'm sorry, I'm having trouble hearing.
Sure. So we do take concern with those within our communities and surrounding communities. The leakage and the contamination that you speak of, I don't believe comes from the packaging per se. It's coming from a leak from a giant chemical processing plant, not from the packaging. You talked about the packaging not being safe. I don't know where that's true because we rely on the FDA and a number of things for its ability to research and stamp its approval. And the packaging you're using now is showing that there isn't leaching into your food. So I don't know if that answers the question.
Representative McAleer.
My understanding is that this is a national organization.
No, we're the New Hampshire.
But
Grocers
but
Association.
it is a national organization, or
We're
not?
a statewide trade association.
Okay, but you're not affiliated with any other ones on a national basis, or not?
I mean, they're partners of ours, but we're not affiliated with them. correct?
Okay, thank you.
All right, thank you. Seeing no other questions, thank you very much for your testimony. And before closing the hearing, we have the blue sheet. We had 1 in favor and 1 against, so 2 signed up total. So we'll close the hearing on 242, and now we'll open the hearing on House Bill 280 relative to the sale of freeze-dried foods. We'll call the prime sponsor, Representative Patusek, to introduce the bill.
Thank you, Mr. Chairman. For the record, Representative John Patusek, Rockingham District 13, which is Derry, New Hampshire. I'm introducing this bill for Jennifer Hewson, who contacted me virtually right after the end of the last session about introducing a bill for frozen packaging. Now, I'm going to read, I hope she sent this out to you. She said she did. So I'm going to read it, and if anybody's got any questions, feel free to just chime in. Dear members of the House Commerce Consumer Affairs Committee, I'm Jennifer Hewson, a resident in Sullivan County, and I'm writing to you in support of HB 280FN. I apologize for not being there in person to testify for her various commitments. I assure you this bill has great value for New Hampshire. I participate in several farmers markets in New Hampshire, and due to current legislation, I am severely restricted in what I can sell through cottage law. Freeze dryers have now been available for residential purchase. They are quite an investment. They are also a very safe way to preserve food for a longer period of time than traditional canning. Freeze dryers are completely automated, freeze food before removing moisture via a vacuum pump. It often takes over 12 hours, and the result is produced that its product is safe and shelf stable. Unlike dehydration, which leaves moisture that allows bacteria to grow, freeze-dried products are dry. You may be familiar with freeze-dried products like hiking meals, astronaut ice cream, or MREs. For those who are veterans or no veterans, MREs are meals ready to eat. Having lived through C rations, K rations, and MREs, I would much prefer the MREs. By allowing freeze-dried fruits and vegetables, you make a healthy addition available to the citizen of New Hampshire that lasts longer than fresh produce available at farmers markets. Freeze-drying retains more of the nutritional content than any other preservation method. The end product is safe as anything a person would be able to buy at their local grocery store. Most people have asked me to sell them freeze-dried fruits and vegetables, and I could not do so under the current regulations. Freeze-drying does not allow for growth of Clostridium botulism, the primary concern of the currently drafted cottage law. Removing all moisture also provides prohibits the growth of microorganisms, which is the second priority of current legislation. Majority of U.S. states, 34 at this time, allow for selling of freeze-dried fruits and vegetables under cottage law, as health benefits and demand are so great. I am very happy to answer questions that you may have, either in phone, email, or Zoom. You may reach her at her email or phone number. For reference, there's a great succinct explanation of the basic process at a certain website. Thank you for your time and consideration, Jennifer Houston, Springfield, New Hampshire. As all of you have this and can communicate with her directly, she is very fervent about getting this information done to help all the consumers of all the farmers markets in the state of New Hampshire. And as an aside, I was on the board of directors at the Dairy Farmers Market, which is one of the best in the state. And I agree with her. And I would have much rather had some of that really good ice cream than in the middle of the summer than sitting there sweating my. Anyway, thank you for your attention. If there's any questions, I'd be happy to answer them if I can.
Representative Burrows.
Yes. Hi, Representative. Thanks for taking my question. Do you know if anybody was consulted who has expertise in serve safe standards or in safe food safety issues?
Well, the next person to testify is going to be Colleen Smith from Food Protection Service.
Okay. Okay.
And she can take the technical questions.
Any other questions? Representative Post.
Very much. And thank you for bringing this forward. I have a question on the methodology in the end, where it says, to the extent that entities are exempt from licensure, this bill will result in an indeterminable decrease in revenue to the state general fund. I mean, does that pertain already?
That's a technical question I believe that Ms. Smith can answer for us.
Okay, thank you.
All right, thank you very much. Seeing no other questions, we'll call the next.
Thank you.
Thank you. We'll call the next person to speak. Colleen Smith from DHHS opposes the bill and asks for 5 minutes.
Good afternoon, members of the committee. Thank you for allowing me to testify. For the record, my name is Colleen Smith. I'm the administrator for the Food Protection Section, which is within the Department of Health and Human Services. The department is opposed to the bill as it is currently written. Amending the definition of potentially hazardous foods to include freeze-dried fruits and vegetables, there's a conflict there in the sense that if the freeze drying was done correctly, the product is non-potentially hazardous. Our concern lies in the use of home equipment and consistency of being able to yield a safe product. Currently, if a producer was going to freeze dry a product such as fruits or vegetables, they would be required to get a license in a commercial kitchen, and they would also have to have their process evaluated by a process authority, usually someone from a university, to evaluate their process. Freeze drying fruits and vegetables, they're not uniform in shape and size, so applying one step might not yield the same results or same dryness in a product to make it not potentially hazardous. With the definition change, a homestead food operator could make this in their home. There are certain home food manufacturers in New Hampshire that are licensed, but many are exempt from a license because they don't gross more than $35,000 in sales, or they're only selling their products from their home, a farm stand, or a farmer's market. So those, we don't regulate those entities, so we would have no oversight on an exempt homestead. So if this was allowed, they could do this without any kind of regulatory oversight or verification that there was food safety training by the operator. We do recognize that home kitchens are limited in size. We're concerned that if it was focused on fruits and vegetables, that this could overwhelm a home kitchen if they were trying to freeze dry a lot of food at once and using a piece of equipment that was meant for residential use, not a commercial use. By altering that product and packaging it, you do limit the amount of growth of spoilage microorganisms and make it more of an environment conducive to pathogens such as salmonella would be one of concern. In fact, the department was involved in investigating an outbreak. This was a dried jerky dog treat several years ago that sickened 43 people, and it was the case where a home food manufacturer, and pet food is not regulated by the Department of Health and Human Services. And in fact, this person it actually follows the Department of Agriculture, but based on their rules, they weren't required to be licensed. They were making the jerky with a dehydrator. They weren't cooking it properly. They weren't cleaning properly. They didn't have food safety training, and that therefore 43 people became ill with salmonella as a result of that product. So again, we do have concerns with expanding what's allowed in a homestead kitchen currently. What's allowed are baked goods such as brownies, cookies, candies, jams, jellies, things that don't pose a large food safety risk. So thank you for allowing me to testify. I'd be happy to answer any questions the committee might have.
I have one question. Under $35,000 in sales, this would not be necessary. Is that right?
Correct. A homestead food manufacturer who does not make more than $35,000 is not required to be licensed. But again, that's really on an honor system. We don't track income, so someone has to self-report to us. We really find that the most times someone's coming to us to be licensed as a homestead is because where they're selling it is requiring it, or they want to sell to restaurants or via the internet. Those are usually the reasons why.
Thank you. Representative Sullivan, you had your hand up?
Yeah, thank you. So how does it work now? I think you explained it a little bit. So right now you allow like brownie. I know there's a woman in Berlin who makes whoopie pies out of her homestead or her house because it says home kitchen or something on the label. So what is the regulatory framework there, and why would it not work for this? Is it simply because you don't allow anything that could theoretically make us sick to be cooked, or?
Correct. So the homestead food operation is limited to things which are generally shelf stable in nature. Things like baked goods, like cookies or brownies, things that if you didn't cook it to the correct temperature, the product wouldn't be saleable. It's by cooking it, essentially you're making the product taste as expected. They're very low risk. Their water activity is what controls the growth of microorganisms, and in those baked goods or things like jams and jellies that are high in sugar, there's very low microbial risk. With this freeze drying, our concern is it's a specialized process, and if it's done correctly, it could have a low water activity where it doesn't pose a microbial risk. Our concern is that there's just so much variation, and again, we're using domestic equipment, not necessarily intended for mass production of food for commerce.
I see. Follow up?
Follow up.
So is there a regulatory framework that you envision that would allow somebody to work? Like, is there a way to go into a person's home and perhaps inspect their dehydrator and be like, yes, this would work, or is that just too complicated?
So if there could be potentially a structure where a license could be required for that, and again, they would have to have their process evaluated by an authority that was qualified to do that, and that specific product, whether it was zucchini or blueberries or apples, depending on what they were doing, is that the product would be evaluated per that product. There is a current mechanism for them to do that now, but it would have to be in a commercial kitchen, a commercial setting versus a home kitchen.
I see. Thank you.
Okay, we're going to go Representative Calabro, Representative McAleer, Representative Gibbs, and we'll go in that order. Thank you.
Thank you for taking my question, Vice Chair. As a retired chef, I think that the spirit of this bill was to make life easier for homesteads to be able to sell what I would consider to be fairly safe, innocuous things. You were mentioning meat and meat-related products. This is strictly for produce. As a culinarian, certified, when somebody is doing something in an operation like this, the last thing they want to do is get somebody sick, okay? So freeze drying really is the safest method of preservation for that particular thing. My question to you is, if we outlaw this and it is safe, this is kind of hampering that that whole thing. What do you think we can do to try and learn more about the process it's doing at home so that we can say this is safe? I mean, it's federally controlled. They have they won't allow these things to be sold on the market if they're dangerous.
And to answer your question, we did consult with university officials at the University of Maine and at Cornell, and they were in agreement that in order to be verify that it's being done safely, is that it should have a process review, which would be they would evaluate based on the size and the specific matrix, the times and length that it would be in the freeze dryer to have some food safety controls. Our concern is that there are a very large group of homesteaders that are without regulatory oversight. So how could we possibly manage that they were actually going to get that done?
All right. Before we go to Representative McAleer, someone please send up the blue sheet. If you would like to speak on House Bill 280, please fill out a pink card. And this will be the last speaker otherwise. Representative McAleer.
Thank you, Mr. Chairman. Is there anything that can be done in this bill? You said you consulted with Cornell and University of Maine and plus the DHS. Is there anything you think you folks could do to this bill, recommendations that would make it passable?
So I would say at the minimum, we would want this group of producers to at least have a food license, so then we could work with them to make sure that they were getting those proper evaluations done by an authority to understand that they could yield a safe product in the end. As I said before, is that freeze drying, if done correctly, could yield a safe product. It's just without any regulatory oversight, there's no certainty that home food producer has the equipment or knowledge to make sure that they're producing a safe product.
Just to follow up, well, could you folks come up with something that meets those requirements?
We would be open to having a further dialogue on that. Yes.
Thank you.
Representative Gibbs.
Thank you. Just for clarification, you referenced an instance where someone made dog treats from meat and a bunch of people ate the dog treats and got sick. Did I understand that correctly?
No. So yes, that happened. But usually the mechanism for them to get sick is that they're handling that dog treat that was contaminated with salmonella, and then they're not washing their hands before they go and maybe grab a cookie or a bag of chips. And we actually had an instance where there was a baby that was probably crawling on the floor at the same time where the animal was also, and also if the animal was sick, then the owner is cleaning up after that animal, which also could contaminate their hands. So
okay,
that they weren't eating the dog treats.
Okay, follow up?
Follow up, may I
Thank you.
inquire?
So you said, I think 73 people got sick?
It was 43.
So 43 people got sick from handling or from cleaning up after the pet that ate the contaminated dog treats?
Yes.
Thank you.
All right. Seeing no further questions, thank you for your testimony. We have. Could you fill out a pink card?
Of course I did.
Okay. And the blue sheet, we had one in favor signing in on the blue sheet. So with that, we'll close the hearing on House Bill 280.
Okay, the next bill we're going to hear is House Bill 645 FN relative to the establishment, relative to the establishment of decentralized autonomous organizations as legal entities within the state, otherwise known as DAOs. And we'll wait for Representative Ammon to introduce it.
Okay, thank you, committee members, for listening to my testimony. House Bill 645 is relative to something called distributed autonomous or decentralized autonomous organizations. And I'll try to explain briefly what that is. Just get my notes up here on the screen. So we're all familiar with corporations. We have different opinions about their usefulness in society. Corporations allow for collective action. So people pull together decision-making, they pull together capital, and they build things sometimes that individuals can't accomplish on their own. Think of a hotel or a cruise liner or an airplane and an airliner. These require collective action. And corporations are granted a certain amount of immunity from the government. The government has something called sovereign immunity. And for a fee and for some requirements, the government franchises that sovereign immunity to a corporation. And the corporation is granted something called legal personhood. And its members are shielded from liability, much as we're all shielded from liability for the decisions that we make as part of the government. Corporate officers are shielded from liability. It's part of the bargain between the government and corporations. And so corporate structures have been around a very long time. So with that in the back of your mind, with blockchain technology, which we've been talking about in this committee for a little while, it's created these new tools, building blocks, if you will, that allow for new kinds of collective organization. And the name that sort of the technologists and the people involved in this have settled on is a DAO, a DAO. It sounds sort of like maybe a Buddhist chant, but no, that would be DOA. Yeah, not dead on arrival, Representative. And so it's enabled new kinds of structures that are similar to corporate structures. They make decisions the way corporations do. They pool resources the way corporations do. But the decision making is much more democratic. It's much more decentralized. It's made by it's a sort of like, you're familiar with crowdfunding or crowdsourcing. So normally you need a centralized website where people put their donations to, and there's a purpose behind those donations, maybe somebody's hospital bill. But the website itself is centralized. It's one website, maybe on one server. And so a DAO is kind of similar in structure, but the website itself is a decentralized protocol. And I know that sounds a little bit mystical, but this is enabled by the kinds of things that you can do with blockchain technology. So I'm trying to keep this fairly simple and not get into the weeds because it can be very complicated. But one of the things that blockchain technology enables is something called a smart contract. So think of a smart contract sort of like a vending machine. So you put your quarter in, now it's probably $2 of quarters in, and you get your Coca-Cola out, right? So the vending machine, it takes value in and you get something of value out. And there's, the little arm that reaches for the soda and it brings it over, it drops it in, right? There's a mechanism inside. So a smart contract is like that. It's code that receives value. In this case, it's some kind of tokenized value. A token could be a cryptocurrency. It could be a token that represents something else. And the computer code does something, and then out comes a decision on what to do. And that code, and this is a key concept, that code is open source, publicly available. It's on a blockchain, and anybody can see it. Anybody can read what that code does. And if you're familiar with how code works, you can validate that the code works correctly. So in an old-fashioned corporation, the decisions are made in a boardroom, and maybe the shareholders don't exactly know what decisions are being made and why. But in this new type of structure, the decision-making is all out in the open, and it's not just a secret board, it's the community of people that have ownership. They've bought into this corporation or this structure, that they have control over the outcome. I think I'm losing some of my audience, so I apologize for that. So in summary, it's decentralized, it's democratized. You can think of it that way. Lots of people. It's autonomous, means it runs in code and not in a legal document or in a boardroom. The decisions are made in code, autonomous. And it's an organization, it's collective action of people. That's where the name comes from. And it operates transparently. It has a more equitable distribution of power and wealth. Is typically less regulated compared to traditional corporations. And it's different in terms of governance, ownership control, transparency, and compliance requirements. So that's kind of my primer on the topic that we're talking about. Now I'll get to the specific bill, House Bill 645. We had the Governor's Cryptocurrency Commission. It met almost over a full year. And I have a copy of the report in front of me. It's about 60 pages. And through those discussions, all the various members that were involved, one of the recommendations, it's actually the first recommendation. And if you download this yourself, it's on page 30 of the report. Recommendations for change. And the very first one is enact a state legal enterprise law for decentralized autonomous organizations to provide transparency, limited liability, and legal status to blockchain networks. So that's the first. And you can read the description of why that idea might be a good idea. So is this a new idea? Have any other states tried this before? I know that's going to be a question. In July of 2018, the very first state to enact a law touching on this subject area was the state of Vermont, which is right next door. They were the first state to enact LLC legislation, so the old traditional style of LLC, and tried to tailor some of it to blockchain-based companies, which a DAO would be a blockchain-based company. So 2018, Vermont. 2021, Wyoming, they enacted the first law to mention DAOs. So 2021, Wyoming. I looked today in their business registry. There are 806 businesses with the word DAO in the name as of today, and I had looked in December of last year, just a month or so ago. So it's up from 660 to now 806. That increase in over just 1 month. And so each filing has a filing fee associated with it. So the state collects some funds based on the filing fees. And then most recently, in April of 2022, last year, Tennessee passed a law that mimics what Wyoming passed. So that's 3 states that have passed laws that are touching on this subject area. Now, there's criticism of all the laws that have been passed so far, that they don't respect the actual nature of how a DAO operates. They're trying to take a square peg and put it into a round hole, trying to take the new way of doing things, forcing it into the old way of doing things too much. And so the criticisms are part of the consideration for House Bill 645. We want to do it better than the other states have tried to do it. So where did the language for this law come from? It came, and there's actually reference to it in the report, to this model language that is in 645. It came from a group called Koala, Koala with a C, not a K. And that stands for the Coalition of Automated Legal Applications. So automated legal applications is it's a fancy way to say smart contracts. And they have a good explainer document so this language was adopted from their model law, and it's a starting point. We heard yesterday that we never pass a bill out of this committee without an amendment. I think this bill will fit into that history very, very nicely. But this starting point came from this group of academics from all around the world who developed this language. And it's a language that is intended for states and even countries to adopt. And I'm going to give you a brief outline, very brief. There's 6 chapters, sections in our bill. So the first 4 sections kind of map to the traditional corporate structures. Chapter 1 outlines the activities that DAOs can engage in and their rights as a separate legal entity, along with important definitions. So that's section 1. I think we call them sections. Number 2 outlines the technical and governance requirements for DAOs to have legal personality and limited liability protection. So just like a corporation is given a legal personhood so that it can operate and make decisions, interact with the rest of society, and also liability protection. Chapter 3 explains the potential actions that may result in forfeiture of limited liability protection, allows for the reasons for when there might be personal liability, and it explains the flexibility of DAOs to create governance structures and reserve funds. So governance would be the decision making, reserve funds would be the capital. 4 deals with the governance of DAOs, allowing for flexibility and representation on and off chain. Off chain, that means in code on the blockchain or in maybe a paper document that the group agrees to be governed by the bylaws. And then chapter 5 addresses technical aspects of DAOs, such as what is a contentious fork? I won't go into that definition, but a contentious fork, it's a fork in the direction of the code. And what happens in the case of failure events? We know when you run code, sometimes the code can have an error. So that would be a failure event. So what are the conditions and technical aspects of that? And then finally, it includes provisions, this is number 6, for when general business organization law should be applied to DAOs and recognition of DAOs as pass-through entities for tax purposes. So those are the 6 different sections of the bill. I think I'll stop there. I think that's a pretty good overview, and I'll open it up to questions. And I'm happy to take any questions, Mr. Chair.
Thank you, Representative. Representative McAleer, I think you were first.
Thank you. Thank you. Keith, a question here. What sort of entity, what kind of business would be operated here? And then you mentioned that everybody that is a player, so to speak, makes a decision. So how does a decision ultimately get decided? So what kind of business and how the ultimate decision, or what maybe an example of a decision that might be considered? Thank you.
Yeah, so there's two questions and they're both sort of broad. I'll try to keep it simple. So what type of business, anything a corporation might have as a purpose, right? Potentially it could own physical property, like say a real estate, an apartment building. But what's tending to happen right now is people are getting together to develop, you could call them protocols, which are not really businesses. It's more of like a language that does a certain thing. So like a simple way to email is a protocol, right? So email is a very useful thing, but it's not really a company. Email is a way for computers to talk to each other to deliver messages, right? So there are new protocols being developed that groups of people are doing, and it might take coders, it might take marketers, it might take people building a website to advertise it, and all different functions that a corporation might have. But there's other examples of what DAOs can do, and I'd encourage you to, look it up, search it. Some interesting ones that I ran across. There was a DAO to buy an original copy of the U.S. Constitution. So a bunch of people got together and they tried to organize that, and I don't think that went anywhere. There's a DAO to organize for support for the war effort in Ukraine. So there's something called the Ukraine DAO that is doing that. So those are just extreme examples, but anything a corporation can do. Corporations benefit from having a hierarchical structure where a few people at the top make most of the decisions and receive most of the information. That's suitable for maybe Boeing and Martin Lockheed. A DAO is more of like a decentralized, crowdsourced decision-making process. So,
Thank you. Representative Fidel.
Thank you for presenting this interesting idea for the state, and I appreciate the effort at trying to bring blockchain into the state's legal governmental structure. I certainly think that blockchain is probably the next revolution in the way that we're going to govern the state as well as govern transactions in the state. However, I think that if we're going to bring blockchain and blockchain entities into being a third type of corporate personhood, as we will have corporations, we'll have LLCs, and we'll have DAOs, this may be the beginning of a bill. But if we look, for example, the state's corporation law or LLC law, we have something more similar to the report you have in your desk, a 60 to 100-page bill, rather than something as thin as this. Part of the reason for that is when we start to really look at when we address personhood, we need to ask questions. For example, if I were to sue the DAO, where do I achieve service of process? If I were to sue the DAO, where does venue occur? If I were to sue the DAO, and where is that suit actually going to occur? And then another issue that occurs in this is that the DAO can essentially bootstrap itself into existence. It's essentially, I exist because I am. But we don't allow corporations to do that because we're not creating corporations for their own benefit. We're also creating corporations to protect the public. That if a corporation creates a bad contract, we want to protect the public against that bad contract. Similarly, if the DAO creates a bad smart contract, we want to protect the public against that. Therefore, we don't allow a corporation to exist because they are. We create a corporation to exist because the Secretary of State said they are. So how do we protect the public against a bad DAO? We need to create a registration mechanism. This, again, doesn't address that. So I think that we need to create...
Question?
Well, I'm getting to the question. How do you address each of these questions that I've created here? How do we achieve service of process? How do we achieve venue? How do we achieve a registration mechanism? And how have other states addressed this? And where do we begin to address these voluminous issues that are addressed in the Corporations Act, that are addressed in the LSC Act, and why aren't they addressed in here?
I sense some emotion in your question there.
Not at all.
So those are all very good questions. And as I said, this bill, if it's going to pass, will be amended. So we're looking for feedback such as what you just stated. The other states that I mentioned have tried to answer those questions by sort of pigeonholing a DAO into the existing corporate structure. We're looking for a more of a carrot approach than a stick approach as to attracting DAOs to New Hampshire, but making sure that they're good corporate citizens. And so some of those questions I think will need to be addressed before this bill. I know there are people coming behind me that will be more expert in exactly what you were asking. So I'll do that thing where we defer to the smart people behind us. So, but thank you.
Okay, Representative Gibbs.
Thank you. Can you explain how it is possible for the members of an organization to come to a decision rather than using what I would consider the normal traditional methods of discussion and vote, but instead by means of computer codes? And then can you explain what the advantage is to the people of New Hampshire of having such an organization? Thank you.
Okay, so those are two interesting questions. Thank you for those, and I'll compliment you on your questions while I think of the answers. So the way that computer code works computer code can display things on your screen. It could make sounds that come out of speakers, right? So that's not the type of computer code that we're talking about. We're talking about specifically smart contracts, which are, you can think of them as like snippets of a program that are, that the inputs are value or tokens. It's not any kind of input. It's specific types of input.
Excuse me, that's meaningless to me. Value or tokens.
Yeah.
What
so
kind of value?
Yes, you may inquire.
Excuse me. Yes, thank you.
what kind of value? So we're talking about digital assets. So we're talking about, remember the other day we were talking about the UCC and about how there are digital assets that people can own and control. That's what we're talking about. And so let me just see if I can relate to something that you might know. So a law, a judge interpreting a law, right? The law was written by humans, and the law in it has what are the conditions that initiate the consideration of that law? And it might have, if this happened, do this, or if this happened, it has a logical structure to the law, right? And then it has either no consequence, or maybe there's a penalty. There's something positive or negative that is the result of that law. Well, you can do a lot of those same things now in something called smart contracts. There's a lot of overlap, and there's a lot of lawyers that are looking to become specialists in smart contracts because there is a lot of overlap. That's how the decision making is made. If I can, keep it as simple as possible.
I'm sorry, that's still not clear. I should
You
tell
may inquire.
We'll explain it to you. It's too long of an
Representative. You may have a follow-up.
Okay, I am a lawyer, and I have written computer programs in the way you have described, very simple ones, but I understand that concept. What I cannot get is from there to a group making a decision by that means.
So it has to do with how the computer code is structured, right? So you need a certain number. Let's say you've written programs before. Let's say you need 51 people out of 100 to decide that something is true. If those 51, if it's fewer than 51, then the outcome is false, right? So that's a way of people being able to vote on the outcome of a cascading logical event. And so that's as simple as I can make it. And the cryptography behind blockchain, one of the things it does is it allows people to prove that they are who they are, or they have control over those voting rights.
Your explanation that it's a vote actually does make sense, and so I
Okay.
thank you.
I'm happy to talk about it
Representative.
offline.
But follow up second half of my question?
Yes,
The
you may.
advantage? if I may?
Yes, you may.
Thank you. Can you tell us what the advantage is?
Yeah, I started out my testimony that way. That it's a new way of collective action, and it's a new type of structure. It's happening right now on the internet in New Hampshire. It's going on. You can't see it because it's virtual, but it's happening right now. And it's a way to sort of democratize collective action. Like some of the things that we don't like about corporations are sort of solved by this new way of organizing, because it's more democratic, it's more egalitarian. It allows people to have ownership over what they're working on instead of being a wage slave in a job. So instead of you accruing all the value to your employer, because you're a part owner, you're accruing some of that value to yourself. And so you're actually able to build wealth by your own efforts with this type of structure.
Representative Spear, then Representative Terry.
Thank you. I kind of hinted at this question before, but I guess we didn't really have time to talk about it. You talk about how the DAO gets started. You have regulations about how it gets started. You have regulations about what happens if the code crashes. You have regulations about how open everything has to be. But what happens if the DAO becomes inactive and it has assets and it just kind of dies? Companies, there are things that happen, and the state can literally take over. You know, if somebody doesn't pay they own a building and they all of a sudden decide, well, I'm just going to abandon it, the state can take it. What happens to a DAO? We need something, I would think, in here that says if the DAO has been abandoned, what happens to the assets?
Yeah, I think in the other state legislation, I think there's a period of 1 year inactivity. So that there has to be, just like a corporation has to have meetings, minutes of their meetings, to stay current with their, being in good standing with the state. The other states have sort of solved it where that DAO would no longer be in good standing. As far as being able to confiscate abandoned property, it doesn't really work that way in blockchain technology. If you abandon it, so I know this is, it can make people's eyes glaze over because it's technical, but
No, believe me, I understand.
yeah, okay. So let's say there's a $1 million of value in some vast protocol, and a DAO owns 10% of it. If let's say they lose their key, or the people all involved die, that 10% becomes unusable. It becomes like lost forever, and the value accrues to everybody else in the protocol.
That's not, I'm sorry.
It's different than what you're saying. I understand.
It's different.
Yeah.
What I'm saying is, let's say the DAO decided to get together. They, 4 guys got I don't know, 10 guys got together, created a DAO, and they wanted to buy land. All 4 of them died in an airplane crash. Who gets the land?
I think that would be governed by what would because you're talking about physical, real world property at that point. It would be governed by what happens now anyway, right?
Shouldn't this thing say something
It could.
about the assets of a DAO?
We're open to suggestions. Yeah.
Representative Terry.
Yes, thank you. Let me preface my question by saying that if I'm going to be asked to act on a particular piece of legislation, it's really important that I try to understand it as best I can, and I mean this very sincerely. That when I'm looking at you and listening to you, I'm hearing some of my my friends in college who were on the engineering track, and their brains worked in a certain way, and they were very good at being able to describe in their own language, in their own lingo, what it is that they were saying. But for those of us who were in the liberal arts, economics and so forth, ours would glaze over. So thinking back to when I was in elementary school, the way that I learned was by reading words, but then seeing references being made to illustrations or figures. And I'm wondering if you could help me and perhaps some of the others of us who are not as far along as Representative Philo with his incredibly impressive cerebral questions that are PhD level, and have, yes, obviously, yes, and maybe do like an illustration, an example of what a DAO is and how it would function, so that I could see this in pictures.
Okay.
I don't need photographs, but
You're a
if you
visual
could
learner.
actually work through do a basic presentation of how it's formed and how it works, that would get me beyond first grade to at least second grade.
Absolutely. I
Yes.
can't.
Is
I
that
can't-
possible?
It is possible. and
Thank you.
Maybe even.
Because I know you can teach. I mean, you're doing it with words.
Yeah,
so.
but visual learning
Yes,
is
visual,
important.
visual.
I'll work on that with you, and we'll share it with the rest
Thank
of the
you. I
group.
really
Yeah.
appreciate it. I think there'd be great value to not only people on this, the members of this committee, but the members of the general public who are going to want to understand this based on what you're telling us about decentralization and democratization of processes.
Thank you, Representative Philo.
So, this was actually to address Representative Gibbs' question, but I think I can do it as a what do you believe? Would you believe that a blockchain is a block of information that is then chained together in a chain of information, but can't be changed because it has to exist on a number of computers, all of which have to check each other's work. And if the computers don't check each other's work in such a way as to make sure that it's right, they reject it so that the record can't be changed. And that makes sure that we're not creating a falsified record. This is different than if I write it down, I can write down anything, but if all the computers have to agree, then it's harder to falsify the work. This actually makes it better than a written record because it's hard to falsify. Every single record on the chain then goes one to the other because they also link data from one to the other. They also have the benefit of existing on every computer in the network so that if one computer tried to falsify it, we have the other, say, 49 computers on the network to be able to check the work off from. So that also helps to create this immutable record. That's why it's of value. Would you believe that, Representative Ammon?
I would believe that. And thank you for responding to that. So it's to follow that line of thinking, what value is it for the state of New Hampshire? Well, no state has gotten this right first. Some state or maybe country is going to get this bill just right. The analogy is how Delaware got their corporate law to a point where all these corporations, started incorporating in Delaware, right? So the apple is out there for the picking, but these other states haven't gotten it right. They're not attracting. And if New Hampshire gets it right, it provides a bridge between the new way of doing things and the old way of doing things, and the bridge connects to the entire world. It's not just our state or our country, it's everywhere. An analogy to that, I can't speak to this in detail, but I know someone that can, is the way that New Hampshire adopted innovations in the trust laws, which happened, I think, a decade or so ago. And the innovation was that the trust laws could interface with jurisdictions all around the world. And so capital from all around the world has come and parked itself in trusts in our state. So this could be a very similar kind of moment and benefit the state of New Hampshire as a whole by providing, potentially prosperity. It's got to be safe prosperity, but that taps into the global network.
Representative Bilo. I'm sorry.
We look alike.
Yeah,
I have a real simple question.
that's your sister.
my twin sister.
I'm sorry.
Just help me understand with the example with the raising money for Ukraine with the I was going to say bao, which is a Korean dish I like. But anyway, why is that different or better than say if we did raise money through a crowdfunding website?
So it has to do. So it's a good question. Centralized sites are easy targets for, let's say the Russians took over Ukraine. They could go after the site. They could figure out who ran the site. They have a central point that they can attack. And so it's ukrainedao.love. You can look it up on your computer. And there's the story of why they decided to create a DAO. And it started with a chat group of people trying to figure out how they could help their fellow Ukrainians. And someone told them about how this would be a very effective way to organize. And that's what they did. And so they've, and the story's on that website. It's kind of neat. Yeah.
And finally, Representative Herbert.
Well, I'm really good in the old way, so this is a challenge. For example, I'll give you an example in the document here. First page, item 3, says the validity of an action by a Dow as authorized under this chapter shall not be challenged on the ground that the Dow lacks power to act. What the hell does that mean? I don't understand the sentence.
It's a legal term. I'm going to defer to someone
Maybe the
behind me,
lawyer
and
over here.
maybe it'll defer all the way back till no one's there. But it has to do with how a DAO can act when making decisions. So sometimes a DAO can't reach consensus. I think that would be one example. Let's say a group of people can't decide on which direction to go, so there's no direction. So that could be one possible outcome.
I don't understand where the Dow power comes from, that it can't, therefore,
Yeah.
it's not important.
So the rules are fixed
Yeah.
in code, in mutable code, as Representative Phil was talking about. And an outcome of a vote could be no action, right? Like if there's a tie in this committee, there's no action. And that could be a reason why Dow can't act, because they can't, in that moment of time, they can't agree on doing something. Maybe later they can. So I think that would apply to the
One final
answer.
question. Follow-on question. Okay, but I don't understand why the sentence is even there. If you can't act, you can't act. But now this references a challenge on the ground that the Dow lacks power to act. To me, that's a sentence that has no meaning, and I just
Yeah.
doesn't compute.
I'll have to look at the original model law, and maybe it got lost in translation with OLS. I don't know the answer to that, so I'll have to get back to you on that.
All right.
Okay.
Representative Porcelli, the last question.
I know you have a section on governance, but can you help me understand what the state is responsible for as far as governance goes? And if it's in the section, just reference that section. I'm not sure what it is that we're asking the state to do.
Yeah. It's something I had further down, and it's about, one of the things, it's about registration. So how do you take a group of people and register, a group of people that doesn't have a hierarchy like a traditional corporation, and register it? And the other aspect is consumer protection, because the smart contracts are the governing documents. In a traditional corporation, they have written bylaws, or their charter, or however they write down their purpose and the rules. But in a DAO, the governing documents is code. It's code on the blockchain. And so consumer protection, we know that most people in the state can't understand the code. So we want to have a way for that code to be registered, so we know which version, what code we're talking about. And then we want a way for, there's something called the accreditation authority that's listed here. I think we all got this piece of paper from the Interoperability Lab. This is testimony that they emailed us. And so the idea is that the Interoperability Lab is a part of UNH, and they check the hardware and software of networking devices. Pretty much any networking device that you buy has gone through the UNH Interoperability Lab. So there's a possibility that we could utilize their existing expertise to have people check the code, so that they can sort of put their stamp that the code is doing what we're saying it's doing, and so that the layperson can have transparency into what the code is actually doing, and and keeping that in sync. So consumer protection, and then also registering with the state, so we have some kind of record, some kind of way to reach out and understand who and what and a DAO is doing. That answer your question?
Beginning to, thank you.
Okay.
Thank you, Representative. Any
right,
other
thank you.
questions? Thank you. Keen Meng Wong from NH New Hampshire DRA.
Good afternoon. My name is Keen Ming Wong. I'm Tax Policy Counsel from the Department of Revenue. The department does not have a position on this bill. However, because this bill does touch on taxation, so we did have a look at it, and we have some comments that hopefully the sponsor or the committee may consider in terms of clarification, additional clarification, should the bill be passed. One of the items that was on this bill is in regards to the pass-through taxation of the profits from the DAO to the members, and there's no mention in the bill in regards to what kind of taxation this is. The DRA assumes that this is relation to business profits or business taxation. The current tax code for the business taxes is to treat the taxation on an entity level basis as opposed to a pass-through basis. So if this bill was to pass, we would hope that there would be additional language that would be amending or additional new language to supplement what we currently have for the business taxes to provide more statutory guidance in terms of taxation on the pass-through basis. The other item that we notice is that there is a discussion on the taxation that it makes reference to, but that it's calling out realized gains. So in the proposed RSA 302-B21, it states that, and that is here. It's the page 8 of the bill, from lines 13 onwards. And so the bill specifically states that the realized gain shall pass through to the DAO's members in proportion of to their token holdings. So that language there on lines 16 and 17, it specifically mentions realized gains, but it does not mention any other types of income. So it is not clear if the treatment for other types of, what's the other treatment for the other types of income, how is that allocated to the members? And another item on the same section for 301-B:21. So this is where it says that the taxation is on a pass-through basis. However, when we look at page 5 of the bill, lines 8 and 9, it says members shall not be held liable for any obligations incurred by the DAO, including but not limited to labor and tax obligations. So it appears that it might be in contradiction with the pass-through taxation. Those were the items that we noticed, and if there were any questions, I'll be available to answer them.
Thank you. Representative Sphere.
Hi, at the end of the, let's see, in methodology, I guess that's, I don't have a page number, but it's in the methodology section. And it says the department anticipates that an indeterminate number of New Hampshire companies that are currently registered with the Department of State and that file annual reports would now qualify as a DAO. This would result in an indeterminate loss of general fund revenues from annual report filing fees. Can you tell me what the basis for that comment is?
Can,
Is it the pass-through issue?
is it, excuse me, is it on the last paragraph of that page?
Second to the last paragraph? Under methodology?
Okay, I see it. Mhm. I believe this is not from our comment because this refers to filing fees. Yeah, that last sentence, this will result in an indeterminable loss of general fund revenues from annual report filing fees. The DRA does not handle filing fees.
Any other questions? Representative Herbert,
Pardon me?
you have a question?
No, I'm just confused.
Oh, your light's on, but nobody's home.
Okay, I'm too confused.
Okay, thank you.
Thank you.
Okay, I have one last card. Bill Ardinger. And 4 minutes-ish.
Thank you, Mr. Chairman and the Commerce Committee members. My name is Bill Ardinger. I'm an attorney who works at the law firm Rath, Young and Pignatelli, which has offices in Concord. Our firm and I, in cases, have acted as lobbyists for clients, and many of you know my wonderful colleagues who are in the building more often. In this case, I am here on my own behalf as Bill Ardinger, a resident of Concord, to speak in support of this bill. And I want to explain briefly why. I had the pleasure of serving with Representative Ammon as the chair of the Governor's Commission to study cryptocurrency and digital assets and issues like these new structures that have been addressed and very well explained. That commission provided its final report to the governor and to the speaker and to the Senate president and others in the state just at the end of 2022. And I have a copy for the record of this hearing that I will leave with the committee, along with a copy of the governor's press release where he described the acceptance of the commission's report. The commission addressed for a year many of the questions that you have already been asking. And during that year, the commission reached a report with 12 recommendations. And that report was unanimously approved, where we had members that were technically proficient, like Representative Ammon. We had members like me, a lawyer, and I'll explain a similar analysis to answer Representative Gibbs' question, who have had a lot of experience with things like trusts, like limited liability companies, and like development of economic development in New Hampshire when I participated in the early 90s revising the Business Finance Authority's structure. I've been around this committee a long time. As a matter of fact, when I was in college, I was at 19, I was elected to this house from the towns of Cornish and Croydon, and I served on the Ways and Means Committee. So it's wonderful to have, since 1989, lived back in New Hampshire and had the experiences I've had, including this one. It's so important to refer to the question of why this is important. And the commission, after studying this, came to 3 fundamental findings. One, that blockchain technology, explained in the ways that Representative Filio said, that it is real. It is something important. In other words, Representative Terry, my guess is back in the 60s when the Defense Department developed the internet and computers started to connect for the first time in the 60s and 70s. This was long before the World Wide Web became apparent with images and visuals that helped explain it. At that time, it was a new concept, but there were some states with their legal systems and governments, federal, national governments, that took steps to build the legal infrastructure required to allow innovation and to allow protection of consumers, investors, and others. This commission concluded that this is a real technology, and regardless of today's papers, vicissitudes of how the technology is going with certain businesses or otherwise, our conclusion was this is going to be real, and it offers potentially very important promises that could benefit humanity, like the internet has come to show, even though the internet has a lot of cons too. The fact is it's changing our society, and it was important for this legislature as well as other lawmaking bodies, even though people may not technically be right on top of the issues right at the beginning, there are some legislators who are, and that leadership allows a legal infrastructure to be built. The second finding we came to was that the current legal system at the federal level, at the national level, at the international level, and at the state level is uncertain. It's not right for the unique attributes of this new technology. That uncertainty is undermining two related things. One, innovation, economic development. It's undermining that. Two, we had participants from 8 state agencies on our commission. It is undermining the ability of agencies to enforce laws that are designed to protect consumers and investors. So number two, we found uncertainty in the legal regime, and we said that's not good for a couple of reasons. That economic development, but also protecting consumers and investors. The final major finding we came to was that New Hampshire, as a state, should take a leading role in developing certainty and developing innovations in our legal system that will support the positive, stable, good development of this technology, and hopefully reap the benefits of having a message out in the economy that this is a forward-looking state. This state drafts good laws that are modern and balanced, and we want to be in that state because they understand what we need in order to innovate and go forward. Those were our 3 findings. On this, when we made 12 specific recommendations, the questions that you're asking are exactly the ones that came up in our commission. The confusion, Representative Herbert, that you have expressed, and I've heard you with the light on. This is new. Same thing happened to me on this commission. But what we ended up recommending is the very first recommendation was New Hampshire should adopt a law that establishes legal status for these distributed or decentralized enterprises, organizations that are right now proliferating out on the internet. They are alive, they're happening, but it's so uncertain that the state who takes the creative lead role in building this infrastructure is going to see benefits. That's the view of this commission. The governor thanked us for our work and also said we should work together to get these recommendations done. It is a credit to Representative Ammon that he introduced this bill. This bill is not the final answer. When I came before as a lobbyist, before this committee and Representative Hunt was the chair then too, in early 2000s, to propose an 80 to 90 page modernization of our trust laws that were created in some cases in the 1600s. We worked very hard with subcommittees, with committed members in both the House and the Senate, and we did achieve enactment of those laws. And right now, if you travel around the world, around this country, people will say that this is a leading state to protect your family, to establish trust for your pet, because other states don't permit that. We were a leader, and it's attracted families and developments to this state. My hope is that the passion that you hear me speaking with as chair of this commission, I'm 62 years old, and I undertook this on a voluntary basis at the request of the governor, and I loved working with everyone on that commission. It was a wonderful experience, is that this committee will take that important step on this bill to establish the working group that is necessary to build the creative answer. Representative Ammon did not start with Wyoming's approach, which has been panned because it's legally not really consistent with what is happening out in the wild. And he started with an academic leadership position that hopefully this hearing today will send the signal to the world that's developing out there, that has a capitalization that is growing, and it's up and down, but just like the internet was. Remember pets.com. It goes up and down, but look at what it is today. Our most important economic companies are tech companies working with the internet. And so my urge to the committee, my ask, my respectful request is that you move forward with this bill to make it better, to develop an amendment that addresses the questions you're asking. I promise you that I will be participating in that effort as a member of the public. And I hope it is very important that this bill go forward. I would like to finally address quickly the question of tax. I wanted to say back in the early 90s, I was there. There's a specific recommendation on tax that would apply, and we'll work with the DRA on that. It is in fact where organizations are serving as financial intermediaries alone. They get the same treatment that our business profits tax, our business enterprise tax already provides to other financial intermediary entities. And I know that because I was a lobbyist. I wrote those rules and it was enacted in this legislature. So that's the intent of there's recommendations. I urge each of you. Well, the great thing is, I'm looking at Representative Terry's comment. We took the time. It's the first report across the country that tried to build a set of plain language definitions for each of the concepts that Representative Ammon was raising. I urge you to take a look at it and to participate in criticizing it and making it better. Because this bill, one of the things it does is it requires organizations that are going to go out there live and attract participants, regular people with computers around the world who connect to the internet, that you have to use plain language in describing your operating rules, your voting requirements, your governance issues. That is an innovation in the legal system that we hope will be part of a final bill. I thank you for the chance, Mr. Chair of this committee, to take an initial shot at this. And I urge this committee to make sure this bill gets a good look at in a nice working group, like I know has often been the case in the Commerce Committee. Thank you, sir. And I'd be happy to answer any questions.
Mr. Ardinger, thank you for your testimony. It was extremely enlightening. Are there any questions? Thank you. Okay, you may have. Yes, Representative.
I'm an English major.
Put
so
your light
I'm
on.
all in for clean language.
Put your light on.
But I'm not a machine. Ammon, what did you say? Machine code reader or something like that? I didn't even know what that meant, and I still don't. But I'm a little skeptical, just by nature. And I have noticed that there's a lot of pro here and almost no con.
Mm-hmm.
And
Raised on
so
the
I
other side.
find that to be out of balance, and I'm surprised by it because this is very, very different. And so I'm just expressing my inability to.
What's the
I
question,
think we're.
sir?
The
This is-
question is, no. Would
it's a
you
comment.
believe we are not getting a fair and balanced presentation?
That's a comment. That's a
That's a
judgment.
comment.
Would you believe?
No.
Well, I don't believe.
No,
I
no,
don't.
you don't do that.
Gentlemen,
We're not here to disparage the witnesses in
No.
character.
And I don't
No,
take
no,
it
I'm
that
not
way.
Their testimony-
disparaging.
Not
you.
at all.
I'm
You're
just saying
judging that
there
you're
is a
judging the
con.
testimony as being unfair and dishonest, and that's not what we're doing.
No,
Mr.
I did not
Chairman,
mean
Mr.
to
Chairman,
imply
please,
that,
please.
by the way.
May I just
We're here for
quickly?
questions.
Mr.
I
Arndinger?
would just like to say, I don't take anything adverse from the comments. In fact, legislators are supposed to be skeptical. I was, even though I was 19 years old when I was in here. Representative Herbert, in your lifetime, you have seen things move from albums to CDs. You have seen things before that the original internet you would have been very skeptical of because it was communicating without any kind of assistance or graphical interface. Right now, you turn on your computer and you can go to look at what that vacation spot might look like that you and your family may be going to. I would urge you to be skeptical, Representative Herbert, but I would urge you also to listen to the possibility that New Hampshire may have an opportunity here. And that's what I think I would suggest. Number one, I think you should be skeptical. But number two, there's an opportunity here for people who studied this for a whole year. That's their conclusion. And we urge you to participate with us.
No, I'm-
Thank you.
Okay, thank you, Representative. Mr. Ardinger, would you believe that I, in another lifetime, had a node on the ARPANET? I know exactly what you're talking about.
Yes, sir. That's the beginning.
That was the beginning, and I worked at Digital.
Yep. Fantastic. I represented Digital when they were here.
Okay, thank you very much.
Thank you.
This was very interesting.
I appreciate it.
And I have no more pink cards. Blue sheet, I have 3 yeses. And right now, HB 645.
Sorry, sir. I had submitted a pink card, sir. I did not receive it.
Did you fill out a pink card?
For the secretary, yes.
Tim Connolly?
Yes, Tom.
For the
Connolly,
Secretary of State's office.
Yes.
I'm sorry.
That's quite all right, sir. Thank you, Mr. Chairman. And I'll be very brief.
Oh, thank you.
Since the Secretary of State, the Secretary of State is not named in the bill, that's to say, if we have no existing responsibilities or role in House Bill 645 as written, but as you all indicated, those are the states that have worked on DAOs. One thing they all have in common is they've tried to develop a legal structure that allows that DAO to be formed. And that's to say, is either to form like the LLC, or for example, the state of Colorado, they found that this consumer cooperatives, which New Hampshire has this law that permits that as well, is also a similar format that's advantageous to a decentralized manner of organization. So we certainly have reason to be excited about the possibility. Again, what as the sponsor as well as Mr. Arndinger indicated, there's a lot of potential opportunity here. And they say that there are several states that have been taking a crack at this over the last several years, and each taking somewhat different approaches. And certainly that the fact that if New Hampshire is going to adopt that legislation, there will be a necessity for it to have a legal structure, whether it be a DAO, be a separate legal entity type of its own, or whether we modify the LLC or corporation laws with changes that allow for that decentralized or type of mechanism. But certainly, we would be excited to work with the committee if they're going to have a subcommittee to identify what those requirements might be, so that they would meet certain requirements. For example, like Representative Filio mentioned, that like LLC form as an LLC, then they will have a registered agent where they can be found, where service of process could be delivered. They'd have to file an annual report to indicate that they have pay their fees and that they are still active in business. So these are the type of things that, in looking at consumer protection for the laws that manage, they're responsible for existing businesses, that certainly we want to see and expect in a statute that would govern DAOs. I'd be happy to answer any questions, but otherwise, I just mentioned, say that the current bill doesn't require us to do anything. And it's unlikely that you'd form an entity where it wouldn't be a public filing where people could view the organization and see that it meets certain requirements in order for them to transact business. Thanks.
Great. Any questions from the committee? Seeing none, thank you very much. Thank you, Tom. Anybody else want to testify? Speak now forevermore, or hold your peace. Good job. Sorry. This is ridiculous. These seats. I don't know why they put them so far back like this. In the seats, because it's like it's that the corner getting around. So that table over there is kind of a miscellaneous table. But if they just move everything, he said he's going to move everything 2 feet forward. That would be helpful. Give a space back. This is ridiculous.
Oh, yeah. I mean, I thought of that.
Well, they moved the rooms around a lot, but I don't know, last year they had all the tables,
Yeah, we know.
roped together. That was so ridiculous the way they had the committee room configured. That was ridiculous. Yeah. Okay, why don't we? All right, so I guess everyone got at 8 o'clock last night or so, got something emailed them. I unfortunately never got it because it was in my junk mail. I know, and that other thing from yesterday, that showed up in my junk mail. That was in my junk mail too. That's why I didn't get it. So, and unfortunately, I'm getting too many emails. So as it is, I'm getting close to 1,000 emails a day, and where they all come from is hard to imagine. But it's right. So. And then so a fair chunk of them end up. All right, so let everybody know what we're going to do. I'm not going to spend too much time on this today because the way I've scheduled it is that next Tuesday we're having a session. So after session, we will come back and we'll do a little bit of subcommittee then. I have scheduled for Wednesday morning a subcommittee, along with a subcommittee of the several other bills that we've already had the subcommittee once, but if you remember, there's a couple I said we'll take this up later. Okay, so that we have to take up.
174 is one of them.
And 174 is one of them. That number, I start to remember numbers slowly, but.
Because I don't have any.
Okay, so. We have 8 early bills, so we'll finish up those subcommittees, and then we'll have some more discussion on this bill. And if it's ready at that time, then we can exec it on Wednesday, and if not, then Thursday, which is D-Day, where we have to have everything done, That day will be opened up for the whole day for us to figure it out.
Okay.
Okay. So, in terms of where we're at in this bill, obviously, I just finally just got it. And then unfortunately, we have no red printers, no red ink. And for those of you who got it, you probably noticed that they did some stuff in red ink, which means when I got it printed here, it was gray, not red. I have shaken down one of the lobbyists for a red version, so I do have the red version. However, before I get too deeply into going through this whole thing, I wanted to have the Liquor Commission review it. So that will be the first primary, is to have the Liquor Commission and go through the whole thing. However, having said that, there is a couple of things that I have right out of the block have kind of noticed, and so we can discuss those, and then we can take up the rest of it come next Tuesday. So first page, this independent lab requirements and everything. Can we do that by rule, please? Have the department do it by rule. I'm looking at you because you didn't like rules. You already told me you didn't like rules before. Is that all right? Yes, I'm looking at you, and just, is that okay that the Liquor Commission will generate the rules related to who these independent are? Well, I would just assume to have it done by rules. Okay. Because I'm not sure in rules they're going to be worrying about controlling interest in three establishments or any single in terms of the word independent means really independent. You've never owned anything, you never got involved, that's what independent means to me. But obviously that can be addressed in the rules hearing. So I want that to be done by rules by the commission.
What if it's not passed?
What's that?
It's retained. What if it's retained?
What's retained?
The bill.
Why were we going to retain this?
No, I want to pass it.
Right.
Okay.
I'm just saying that if and when, no, not our rules, the
Right.
rules hearing
Setting up
to be it would be the new title, which the Liquor Cannabis Commission would then look at generating the rules for what is an independent lab. Okay. Rather than putting it in statute. So, the next thing that I noticed that I want to revisit is the tax situation. And right now it has reference to the rooms and meals tax. And I don't like the idea we reference rooms and meals tax because rooms and meals tax changes. So the last thing I want to do is be changing taxes around. And so what I was going to suggest, and this is obviously up for discussion for everybody, is right now our rooms and tax is 8.5%. But what I have in front of me now is what other states have done in terms of taxation. If in a perfect world, if we were to again try to compare it to industries that we do now, in terms of the beer tax, the 30 cents a gallon, is collected long before it's before you buy your beer. That tax has already been paid. And it's done the easiest way to do this is to have enforcement, the commission's enforcement, to be able to track what they see and what scene they see going out the door, what they can track. So you want to do some taxation at that level. So our 30 cents a gallon is done at that level. For instance, that 5% that we were talking about, the wine, that is done again at the winery. They're going to be paying that tax to the commission. So what I was thinking is the state that is that our sister states, that is the issue of whether when we set up a tax rate, that we want to be somewhat close. Vermont is 14%. In Massachusetts is 10.75, which I was a little struck by because I thought there was another local tax on top of it, but I don't know. And Maine, which is our closest neighbor, has not only they have a 10% tax at the retail price, but then they have $335 a pound for the flour buds, I guess, $49 a pound for the trim. And the only thing I can imagine is the trim. Is that means they took the stems and seeds out of the flour? Does anybody know?
Right. Can we just hear about the amendment and not?
This is something I'm recommending to change in the amendment. The amendment, I mean,
But
you read
you're
it,
not-
right?
You're not the only one on this committee.
No, I'm asking you guys what you think. I'm asking you, what do you think if we were to change our tax to 5%?
I want to hear I want to hear the amendment before we talk about taxes.
Okay. What would you like to hear about?
The changes.
Who would like to describe all the changes?
Matt will.
Okay. I already said we're gonna have to go through it with the commission to look at it.
Thank you, Mr. Chairman. Committee, good to see you again.
Okay, it's fine, it's fine.
For the record, Matt Simon, I work for Prime ATC,
So you're actually,
and I want to clarify that I am not authorized to speak on behalf of all members of the coalition, but I will do my best to describe the amendment and the positions that we have discussed and the reasons for them to such an extent that I understand them myself. So just a very brief overview of the amendment. I don't want to go through it with a fine-tooth comb, but the first section at the top just changes the definition of the Liquor Commission to change the name to the Liquor and Cannabis Commission. That was borrowed from the amendment that was offered in this committee. The second chunk of text is the independent lab requirement. This was text that was included in the coalition's original draft. It was not included in the introduced version of HB 639. As a coalition, many of us thought these were important provisions to consider. If the committee chooses to reject them, we understand that. We would push for these things in rulemaking in all likelihood, or at least I would. But just to describe the section as you see it, it requires in statute that no testing lab have a financial, or that, no cannabis testing facility or individual with a controlling interest in a cannabis testing facility shall have a direct or indirect financial interest in an ATC, a retail store, or any other cannabis facility. And we just think that's basic sense. If people are going to have confidence in the testing system, it does need to be independent. There are too many incentives for a company to try to sell tainted product. If they have a massive batch of flour that gets contaminated with mold, that's a lot of value that they have to destroy. And if nobody polices that, then it could happen. The rest of the section, we chose to leave that in for this draft for your consideration. These were the anti-oligopoly provisions that were in the original amendment. Again, mimicking other states, Massachusetts allows no more than 3 establishments of any single category. Still on the first page, it's still in the independent lab requirement. Financial interests prohibited is the name of the section. So Roman numeral 1 deals with the testing facilities, requiring them to be independent. The rest of that section is designed to prohibit excessive market concentration, understanding that the market is of a relatively known size. Back to the question of, do we want 5 companies to make all the money, or do we want the economic opportunities to be more broadly distributed? This would require, at least the beginning, there would be a broad distribution of economic opportunities, and then there could be consolidation of the market after that, so that a person or entity could have up to 20% of operational facilities. So this is based on provisions that have been found to be intelligent in other states for the purpose of keeping out, quote unquote, big marijuana, unethical large corporations that might try to wreak havoc in New Hampshire cannabis and not be committed to the values that the general court may want actors in that market to be contributed. So I'd encourage you to just review that. We wanted it to be considered, and that's all we're asking, is that it be considered. Those are the only additions. The rest of it is language that's been removed or slightly tweaked from the introduced version of House Bill 639. So that bill's already had a public hearing. I don't feel that I need to read all of this. Cannabis Commission has been deleted. The establishment of the Cannabis Commission has been deleted. It's replaced with the Liquor and Cannabis Commission. And it simply provides much more statutory guidance and independent oversight in the form of the Independent Advisory Board, as we discussed previously. The home cultivation provisions and all references to them have been removed. The annulment and resentencing provisions have been removed.
What page are you at now?
I'm not anywhere. I went back to generally describing what you see, and now we can scroll through, if you like, beginning on, where it says red, language to be removed. That's where the
Right.
bill actually starts.
Right.
So this first section deals with a fund administered by the Department of Health and Human Services. This is a piece that I believe DHHS and New Futures feels very important, that there be a fund and that there be allocations for a number of reasons. Roman numeral 5, allocations used for the following: evidence-based voluntary programs for substance abuse-related education, prevention, treatment, and recovery, mental health treatment, funding and training to foster an informed, adequately paid behavioral health workforce, and scientifically and medically accurate public education campaigns. And it also requires a report on that fund every 2 years, I believe. Okay. Next, we have the drug funds. One recommendation, and this goes back to the study commission that New Hampshire had a few years ago. One thing that every state recommended was that you begin by collecting good baseline data, because if you don't have good baseline data, it's really hard to tell cause and effect after legalization. So you're still hearing statistics from Colorado that are very confusing. And they are very confusing because in many cases, there was not baseline data available prior to the advent of legalization. So you see a statistic jump way up and you think, oh, this must be the result of legalization. Really, it's because they started collecting data that they were not collecting before. So if you send more fishermen out into the sea, you catch more fish. That doesn't mean there are more fish. And that creates a pretty distorted picture. So this was just a recommendation of the study commission and of pretty much everybody they heard from, that you want to have this baseline data and start collecting it as quickly as you can. Next, we get into the regulation of cannabis, Chapter 318F, the definitions. I'm not going to read all the definitions.
Now we're on page.
Bottom of page 2 is where the definitions begin, 318F1. If anybody has any questions, I'm happy to try to answer them. The only one that's really new is the dual use certificate, which is part of the transfer of the therapeutic cannabis program. It would allow ATCs to serve the adult use market if they qualify for a dual use certificate, and there are rules and regulations around how that would happen. So possession limit, deleted all the references to plants. And I'll note that the possession limit was simply modeled from last year's HB 1598. The 4 ounces, 10 grams, etc.
Okay, so I'm on page 4 now.
Yes, I've made it through to the bottom of page 4. No questions so far. So there's the restrictions on personal cultivation. That all comes out. F3 comes out. F4, no person shall smoke cannabis in a public place. F5 provides a penalty for consuming cannabis while operating a moving vehicle, and I would clarify that that is not a penalty for impaired driving. It is already a crime to drive while impaired by cannabis or any other substance. This is a lower threshold of easy to prove. Somebody was consuming while they were driving, creating a risk. So this is a lesser crime that is easier to prove than an impaired driving case.
Because they can smell it, or what makes it easier?
Determining impairment is a challenge.
Right.
We have drug recognition experts who are trained to be able to evaluate impairment. And if somebody's suspected of impaired driving, there's a process and they go through that. They could have a blood test. But if somebody's smoking a joint driving down the road and a cop sees them, that would in and of itself be an offense.
Got it.
F6, cannabis accessories authorize. This would allow for sale of accessories, paraphernalia to individuals 21 and older. And it would give the Liquor and Cannabis Commission authority to enact reasonable regulations for what accessories are.
I have a question about the sale of accessories today. That's legal. Well, I guess it depends on what it is.
I agree with that. I think it depends on what it is. There are a number of stores that sell a wide range of accessories. Some accessories could potentially be used in extractions and could be dangerous. So I think having some rules and at least the authority to make those rules makes sense. I'm not immediately aware of any dangerous accessories, but some people do use accessories that are probably dangerous. They could contain metal or other lead, I'm sorry. It could contain cheap metal that contains lead or whatever. So like, in the interest of consumer protection and health, this is probably a good authority to have.
Don't make it Chinese lead.
Yeah, it actually is an issue. People buy cheap vape cartridges in bulk from China, and they're made with a very cheap
No, I remember
metal.
that with the toys. They were talking about the toys from China, that some toys were made with lead. Or
Yeah. So even if you get
that something was wrong with the paint.
even if you have your cannabis oil 100% tested, completely free of contaminants, it can take on contaminants by leaching them out of the bad hardware.
Okay.
F7 deals with odor and personal possession and suggests that they are not grounds for a search. And this is something, there's case law on this, and other states have done this. I'm not an expert on it. I was hoping Paul Toomey would be here in case anybody had questions. But it also clarifies that that section does not prevent them in any way from conducting impairment tests or trying to determine if somebody's impaired. F8 was the Cannabis Commission. That's absolutely gone. Some of this language might want to be re-included in some way, but it just all goes away in this draft.
You have a question, Jason?
Well, instead of stepping through all 40 pages of this thing, can we just stipulate that any further changes being offered right now are simply to remove references to home grow and annulment?
Evidently, Jane would want to go through the whole bill.
No, not the whole bill. I wanted to hear from somebody outside of yourself.
You like to hear from me?
I hear enough.
I'm happy to resort to skimming if that's more helpful.
Well, I'm using this opportunity to number my pages, but so obviously there's nothing really changed too much in the remaining. But yes, so we want to go through the stuff that's being deleted, I guess. So everything seems.
Mr. Chairman, may I ask a question?
Yes, Representative Gibbs.
Thank you. This may have been answered previously, even if it has been, I apologize. But I wanted to ask why the annulment of arrests and convictions is removed.
I
Because
believe that was a policy decision
Yeah.
made at the
that's
last
not-
meeting by the
that's not
committee.
something we would normally deal with. There is a bill right now to deal with that that's in a different committee, because that's actually a criminal justice issue. So that is in their committee.
Thank you.
So I'm sorry to correct you, Mr. Chairman. There is another bill in another committee that deals with home grow. There is not another bill that deals
Oh,
with annulment and
That's true.
resentencing.
That's right. You can't do the annulment until we actually pass it. In other words, you gotta pass, you gotta legalize the marijuana, then you can do the annulment.
I'll just say from the coalition's perspective that we dearly wish it could be included, but if there are political reasons that make it that this bill won't pass if that's in there, we're willing to work with the general court and try to make it happen next session.
Yeah, it just, we don't have the expertise to evaluate the annulment.
Any other major changes?
No, F9 is just the advisory board, and we made it apply to the Liquor Commission instead of the Cannabis Commission. So it's 13 members, 1 expert in cannabis cultivation, 1 expert in cannabis retailing, 1 expert in product manufacturing, 1 in testing, 1 ATC rep, 1 patient, 1 representative of consumers, 2 public health experts, 1 law enforcement expert, 1 expert in social welfare, criminal justice, 1 in financing. And, obviously this could be rearranged in any number of ways, and there may be suggestions on that, but the idea of independent oversight is something we think is really important.
Just as a matter of palatability, could we leave the name of the Liquor Commission just as the Liquor Commission? It already oversees tobacco, but we typically refer to it as Liquor Commission rather than liquor and tobacco. I think it just might be a better sell to the public, particularly those who are perhaps more difficult to bring on board to this. Leaving it just as the Liquor Commission, and perhaps in time it could become the Liquor and Cannabis Commission. Could be an easier sell.
I agree with you. We could call it the Sin Commission.
What's that?
The Sin
You know what? Absolutely. We're going to call it the Sin Commission, just pulling everything.
Representative, but did you mean still 2 commissioners?
Leave it exactly the same. We're
Okay,
just
just
going to
change
brand
it,
it
yeah.
differently. Just
Yeah,
call
we
it the
just
Liquor
want to-
Commission.
Yeah, I think you're right. I think you're right.
I'm much more interested in policy than what we call things, so.
Okay, so to the next, where I see things are being deleted, I'm now looking at, because I'm probably the only one who's numbered his pages now, but I'm now looking at page 17, which is actually 318 F23, in which now this is your annulment.
Yeah, there was some references to the annulment language in the section on data collection, and those have been
For data collection.
marked to be removed.
Right.
Similarly, the cost of administration, direct costs incurred by the annulment processes, that language is
Good.
removed.
Yeah. Okay. And then moving right along. So 19 was all the current law that was already it's in the bill that's being deleted. Okay. So then I have page 20, section 15 of the bill. Again, it's more annulment language
Mhm.
being removed from the bill.
Yes, Mr. Chairman, I want to talk about briefly, it's on page 23, the section that says certain crimes not to be pursued dismissal.
Okay.
So this is a policy choice for the committee. It was part of the annulment section, but it only deals with cases that are pending after this law passes, but before the effective date. So if somebody has a charge for possession that will be becoming legal and they get it after this law passes, it directs the prosecutors to dismiss and not pursue criminal charges. And that's just to prevent anybody from, experiencing an injustice between the legislature approving this and it taking effect. So if you think it's important to remove that section, I don't think we will object too strongly. Prosecutors are capable of dismissing cases without being directed to by the legislature. That was generally the practice in Vermont without them being required to, but a statute would require them to, and we would prefer that.
So how far does this go?
Just a few paragraphs there, 1, 2, and 3.
It's all section 50. It's all section 15 of the bill. Okay. Right. Then 16 we get into taxes. Okay.
Right.
That's fine.
Okay. That may be everything. If you have any questions, I'd be
Okay.
more
Well,
than
then
happy
I
to
want to
answer.
go after section 17. So I'm on page 23. And this is where the taxation is wrapped around the meals and rooms tax. And it goes from, and also section, so you get, starts at 17. Because you're going to pay your business profits tax, right? Yeah. And this it brings your ATCs into for profit. That is in this section. Am I reading this right?
I believe that's a little further down, but yes.
Oh, I see.
We're
all the
close.
trees actually, no, outstanding federal taxes.
I'm sorry, what page are you on, Mr. Chairman?
I'm 23.
Okay.
So actually the section numbers, but that's normally how we, the legislature, know what paragraphs we're talking about. So in this case, you renumber them, 16 to 17 is where the tax, 17, 18 now is the tax rooms and meals. So I was just looking at 16, 17, which was the business profits tax. Okay. So, yeah, we want, I personally think, and we can discuss this, that we should decouple this from the rooms and meals tax, that it should be its own separate tax, and that I recommend 5%. It's half a main. And 5% is a pretty nominal tax. 5% is what we charge for wine. So we have a history of the 5% tax. 5% is 5%, but yeah, wine right now, wine is 5%. So, but it's enough of a discount that someone's going to feel that 5% when it comes to purchasing, and the whole idea is for us to be attractive to out of state.
We're talking about 5% on a couple $100 purchase too, not just, it's not like a pack of cigarettes, right? Like,
Right. So, yeah.
So
Well,
5% could be significant. The difference between Maine and New Hampshire could be significant to drive cross-border sales.
so yeah, Jason, you.
I do believe you're also talking about some cultivation taxes.
Yeah,
as
so
well.
then along with that, so they added not just the 5%. So then, when I was working with the chairman, we were discussing that in the perfect world where you would want to do a tax is at the closest to the production level. So, for instance, our 30 cents a gallon is charged to the beer, manufacturers. So that in Maine also not only has that 5%, 10% excise tax, that's where they have the flower, the trim, the immature plant or seedling, and per seed. So, does anybody know about Maine's taxes or know what they mean? But the question I had is like, it says 1.5 per immature plant or seedling. So is that do they sell plants or seedlings, or do they sell the seed, or do they sell, or is this is this April 1st? Like April 1st, would you have to do an inventory tax?
I'm not sure about April 1st. I can provide some information. So first of all, yes, you mentioned 10% in Massachusetts, that sales are also subjected to their 6.75% sales tax. So it's really a 16% tax.
I knew it was
And then there's a
higher.
2%
I knew
local
it was
option
higher,
tax. So
yeah.
it ends up being about a 20%
That's what
effective
I knew
tax
that
rate.
number. Yeah.
And that's incidentally the lowest in the country, Massachusetts and Vermont. Maine has the 10% tax, plus they have the added cultivation tax that brings it up to around an effective tax rate of 18 to 20% is my understanding. I'm not a tax policy expert,
Right.
and I'm generally pretty agnostic on the tax questions. I would caution on one front with the cultivation tax. As we discussed yesterday, there is a possibility that interstate commerce will become legal, as I mentioned, possibly by a court ruling indicating that forbidding interstate commerce in cannabis is unconstitutional, a violation of the Dormant Commerce Clause. So if that were to happen,
We would have to,
we wouldn't be getting much from a cultivation tax in all likelihood. Retail stores would be selling cannabis grown in places like California where it's cheaper to grow.
we
So
wouldn't get any tax. No, we understand that.
it may be reduced quite substantially.
Right. But just so you know, it's interesting that the the beer tax. Is Mark? Are you still here? Yeah. So that 30 cents a gallon, because it's collected by the beer distributors, isn't that tax still applied to beer that was brewed outside of the state? That 30 cents a gallon. So we do, because we tax it at the distributor level. That's why we're able to get. Right. So let me put my thinking cap on that one, because in terms of how we would structure so that if there was a change in tax, because theoretically, if it was coming from out of state, it's got to be trucked in. It's got to be. So what we do now in New Hampshire is that we still require an out-of-state beverage manufacturer to register with us, and then we tax their beer at 30 cents a gallon. Is that, you think that's right, Mark? Am I right? All right.
Mr. Chairman.
You didn't bring Matt here. He would know that right on the top of his head.
Mr. Chairman.
I think I got it right. Yeah.
Yeah, I'm just trying to understand your thinking. You said in a perfect world, it would be, I guess, like the beer tax done at the
Cultivation
level. Like, what's your thinking on in a perfect world that versus just at the top, so we don't have to worry about any of the stuff below?
The reason why the cultivation level is easy is because that means that right at the moment where the stuff is created, the marijuana is created. The problem is once it leaves the cultivator, then now it's going out the door. So how do we make sure that everything that goes out the door is taxed? You don't want, if you wait till another time, you don't know where the marijuana came from. Did it from other sources, and didn't get its original tax. But it is more difficult for the commission to track and audit. In other words, the best way to audit is to audit there on the facility, seeing what's going out the door. And so historically, that's you know that's what we like our auditors to be doing, is that when they go into beverage manufacturers, now they have expanded duty because they have to also making sure that the beer that is not delivered out, because originally the beer tax was collected by, or is collected by, beer distributors. So if the beer is not going out the door, it's being consumed there, the auditors are going to make sure that all that beer that's being consumed there on premise is also paying the 30 cents a gallon.
I see. Okay. So the real issue would be if someday if we're importing it from somewhere else, we need a system there, which is what you guys are talking
So
about.
if we compared it to our current beer model, which was, we would require any outside producer who is shipping into the state that they would have to get an out-of-state license.
Mhm.
And then all that out-of-state license is, okay, I'm bringing it in, it's coming in. And then once it comes in the state, then we would get theoretically our tax.
And so it's easier to do it that way versus just at the marijuana shop, you think?
In terms of ensuring that there's not anything funny going on between where it comes into the state and we're going into the store.
Gotcha.
You want to make sure the truck is really going where it's supposed to be going.
I see. Okay.
That was the model of the 3-tier system, was that kind of regulation.
Gotcha.
I see another hand up over here. Yep.
I'd be inclined to actually to do all of the taxation at the cultivation level to continue with a tax-free New Hampshire type of model. It's all a sleight of hand because, of course, the consumer is going to pay for it in the end anyhow.
That's true.
And we could then have the marketing advantage. What is the tax on marijuana in New Hampshire? It's 0. Well, of course it's not 0. You're still paying for it. The difficulty would be the interstate commerce issue, but we could also put a sunset provision in there. If X happens, then Y, which is easy enough to write if we were to just give it to DOJ to write a sunset provision.
Yeah, the other problem, I was thinking of the economics of it. And that is that now the guy has spent all this money, he's now growing it, and he's delivering it. So it's selling it, and then he's going to be collecting has to pay the tax at the time. So what's interesting about when you think about when the wisdom of having the beer distributor collect the tax is that now the beer has left the manufacturer, he's gone to the distributor is delivering it to the on or off premise licensee. At that point, and this is unbelievable, but we have a law that says that those on-premise, off-premise licensees must pay their bill in 15 days. Well, why? Because in that bill is the 30 cents a gallon tax. So then it goes to the distributor, and then the distributor then sends it to the Liquor Commission.
Right, which is a problem that I thought of. We could create a type of credit or something to that extent for the
it's
for the
an awkward-
cultivator, but
yeah.
it's not an easy problem to tackle. But there is a marketing advantage if we're trying to compete against other states.
I agree with you, but I was just a little worried that if we made the cultivation tax too high, it then becomes a burden on the cultivators, and it was all this more and then again makes a burden on how we have small cultivators. It's now you got to be a pretty wealthy cultivator because you got to upfront that cash. So I was thinking that yes, it is a possibility that cultivation tax could disappear altogether, or that we'll end up doing like we do with beer, which is that if you're importing your marijuana into the state of New Hampshire, you'll get a license, the out-of-state beverage license. How do you do that with that, Marcus? Have you looked that up yet? Or?
Yeah, it's by the
Right. Right.
So it's tiered.
It is tiered. So we can consider that. Now, just so you know, this is where back when I wanted to do this all by rule later, but I certainly understand that if we're going to get this legislation off the ground, people are going to want to know what the tax consequences are up front. Before they make an investment, they want to know what the tax structure is. So I'm not wedded to anything yet. So let's just all think about this so that when we come back on Tuesday, people can, see where you're at. But so I was thinking, so assuming that immature, do we know what the immature plant seedling or the per seed, what is anything about that tax?
The issue was, I believe, if you create a single tax rate for all cannabis and it's weight-based, flower is worth much more. Trimmed,
Right.
high-quality flower is worth much more than trim. You
Right.
can make extractions from trim. You can make edibles from trim. And, I'm not an expert on such things, but this was a way to reflect that. I
So
guess
that the immature plant is the male plants? Or the
no, an
ones that-
immature plant would be a seedling, defined as usually under a foot tall, and some stores.
And they would sell those?
Yes, home grow is legal in Maine, so that's the reason. There's a robust
because
market.
they have homegrown in Maine?
Very much so.
Okay, so we don't even need to bother with those two then. The per seed, we don't need to
We-
bother with the per seed.
We probably don't.
We don't need to do the per seed. We don't do. All we need is the flower and the trim.
I think that would make sense to have those two categories if proceeding with a
Right.
cultivation tax. If I could just point out that where cultivation taxes have been enacted, Alaska's another example, the main argument for that has been wanting to create a stable tax rate that would produce stable revenues over time. The knowledge that if you have a retail tax only, it'll be percentage based and it'll be dollar based. So when the price of retail cannabis cuts in half, your taxes will also cut in half. It's a percentage of the revenue. And there's an understanding that once the market becomes mature, prices will drop considerably. So by taxing from the cultivator by weight, that theoretically gives you a more stable, if it's whatever per
Yeah,
pound.
it's cheap in Alaska. It's only $50 for the mature per ounce. Oh, per ounce.
Yeah, it's actually
Okay,
quite
so
quite
that-
high, and
that's
they're
gonna
having
go
a
higher
lot of
by either the
issues.
pound. Okay.
It's not flexible has been the issue with it, and when the market evolves rapidly and market conditions change rapidly, and you have a tax that's by weight like that, it has a dramatic impact. I will say, just from the perspective of the why we chose the rooms and meals tax, one reason was we've heard from a number of members that they don't want to vote for any new tax, and that by putting it in an existing tax was not creating a new tax. So that seemed to be helpful in at least picking up some support from some members. And while revenue has never been I've never sold cannabis legalization as a windfall for the state or said the money's the reason we should do it. I do talk to legislators in both chambers, and I know that some individuals do want the state to make substantial revenue off of this. So having a tax that does produce some revenue is probably important to getting some votes.
Right. Okay. But you guys did not have this at the cultivator level in the bill. You just had the 8.5.
We chose not to create any new taxes, Mr. Chairman.
Okay. Yeah. So, all right. Okay. So anyway, we can talk about that. So, but let's say for the premise I'm running on right now is the 5% at the retail level, and then I guess Alaska looks cheap, but then as compared to that $335 a pound, but what 50 times 16? That's a lot. That's a lot of money, ain't it?
When the price for an ounce drops to $50 an ounce and you have a $50 tax on it, then it becomes pretty exorbitant at that point.
That's pretty steep. Okay, so
100%.
going back to cutting Maine in half might be okay. Okay, so Maine is 335. We'll call it 340 divided in half. So, and then the trim is 94. So somewhere in there. So 50 and 175, something like that. Okay. Everybody?
Yep.
Okay. And anything else? Jason, did we see anything else? I think that was. Okay. All right. Great. Anybody else have anything else they want to add? No. You've been voted down. Sorry. Okay. We're done.
Mr. Chairman, our next meeting is Tuesday, 30 minutes after the session
After the
ends.
session. Correct.
Thank you.